Good morning. The Finance Committee is adjourned at 10:03 a.m. on Monday, April 18th. Convening, not adjourned, yeah. Could I have a, why don't I call attendance first? I'm nervous. To my right is Alderwoman Finlayson, present, and to my left is Alderwoman O'Neill, who is present. Can I have a motion for the approval of the agenda?
Madam Chair, move approval of the agenda as written.
I second.
All in favor signify by saying aye.
Aye.
Thank you. Can I have a motion to approve the minutes as written? There are two sets of minutes. We can do both, up to my colleagues on the motion.
Madam Chair, what's the date of those minutes?
I have March 16th and April 6th.
Then I'll move approval of the minutes for both the March 16th and April 6th meetings.
Second.
All in favor signify by saying aye.
Aye.
All right. I think it's important to say, especially at this meeting, that the Finance Committee shall handle all matters relating to the review of the budget and continuous surveillance of the budget, and the Finance Committee shall have power to review and make recommendations with regard to the mayor's annual operating budget, and shall submit recommendations with regard to the budget to the City Council not later than the second Monday in May of each year. And that's why we are where we are. So I think I'll proceed with, there's no fund transfers today, no supplemental appropriations. We have department reviews. We do have one piece of legislation and then an acknowledgement of the ordinance on the budget and the fee schedule. So if there's no objection, I'd like to proceed with the department reviews. First, though, I asked the city manager, since this is the first department review, I asked the city manager just give a brief summary of what the departments were asked to provide back in February.
Thank you, Madam Chair. So what we've asked is we put together a standard template for each of the presentations with standard content, so it should be consistent between departments. There'll be a lot of focus on the performance management system. So as each of the departments work through their presentations, you'll first see their mission statement, which we think is very important, followed by an organization chart that shows the way that they're structured and organized. They'll talk about what their FY22 current year highlights have been thus far through the year. We're not through it, but we're 9 months through it. They'll talk about the goals that they have for FY23, and then they'll break down each of those goals by objectives, benchmarks, and performance measures. The different departments will have different numbers of goals, but they'll run through the goals for the department. Then they'll talk about their longer term goals for the next few years. So not necessarily for FY23, but for FY24 through 27, so the following number of years. They'll talk about those. Then they'll talk about what they feel like they were most successful in meeting, which performance measures they were most successfully able to complete, and which ones they were least able to complete. Because that's instructive for the budget. If there's areas that they're not able to complete that perhaps more resources would help with, it's important to know that. Then they'll talk about their budget request, some comparisons over the FY22 and 23 budgets, some of the additional items that were added to their budget from 22 for 23, and then it'll open up for questions. So that'll be the standard content for each of the departmental briefs.
I also asked, but I wasn't sure if you were able to provide, just to put this in perspective, that for each department, Mike, what I asked for, and I don't know, Kate, if you're able to provide the pie chart. Beginning with each department, I want to present a pie chart of their budget, their slice of the pie, if you will, in relation to our entire budget, so we see what kind of magnitude we're looking at. And then also a pie chart of the department's budget allocated in the categories that we asked for. And a little bit of housekeeping. I think 3 hours is ample time. I don't want to keep anybody longer than we have to. What I suggest is that you present without interruption, unless it's, like you really need to ask this. And then my colleagues and myself ask questions. And then anyone on the council that is here will have a 5-minute rotation to make sure everybody is heard, and then go back and ask another 5-minute rotation. So that's hopefully what we can keep to. There's 2 presentations today. Obviously, yours will take longer than MIT, but just want everybody to be conscious of everyone else's time.
Just one quick comment while Katie's pulling up the pie chart. I think the pie chart's going to show by the general fund activities, so the slice of each department within the general fund. But that will leave off departments like transportation. They're entirely enterprise funded. Public Works, you'll only see about half of their size because about half of their funding is from enterprise funds as well. Just that disclaimer. Because I don't think we have that pie chart set up for all funds, as far as I know.
We included it in the our presentation Friday, but I can.
Just for general fund though, right?
That's
The
correct.
general fund breakdown.
Yeah, and I guess it might be easier if I print all these off and maybe we have a packet, so that way the departments can still present their presentation and then you guys can reference that.
But
Would that be better? I can go downstairs and print that off for today's presentations.
Alderwoman Finlayson.
Yes, Mr. Gerald, or maybe I should ask you, Madam Chair, so how are the enterprise funds being treated? Will there be a separate time for that? Or, for example, will Mr. Johnson present his operating budget and then separately his enterprise fund?
No, I don't want to.
I was just talking about the pie chart that we're going to show, because the pie chart that we used on Thursday was just for the general funds. Remember, because transportation was on there. Director Dickinson is going to report now that they can put together one for all funds, so it shows truly what the entire department budget is and what piece of the pie it is for all funds.
And I understand that. My question is, how will the enterprise funds be treated? And when will we get, and from whom will we get information on the enterprise funds?
They'll be presented as part of the departments that have.
Okay, good. That's what I was hoping.
Thank you. Yeah, that have it. So Public Works will have both general fund and enterprise fund. Transportation will present their budget that's just enterprise fund.
Thank you.
Director Dickinson.
I'm going to hold it down. There we go. Is it working now? I have to hold it down. All right. So I just wanted to. It's on now. So at our presentation on Thursday, we mentioned that there were some departments where the performance measures that are in the book were not their updated ones, and fire is one of them. So just so as you're looking at what they're talking about, their performance measures, it might not match up exactly with what you have in the book.
Okay, all righty. And again, just to back up on the general fund, just as you compare city budgets, the general fund comparisons are what's compared, and so it's really just to evaluate, comparables and et cetera. So, I mean, for example, this is fire department. If I'm not mistaken, that's the pie chart for fire department where, it's quite in line when 90% of your cost is staff. And if it showed like 50% would be concerned, that's just a measure. So without further ado, unless there's any other questions from my colleagues, you can start, Chief Romali, and introduce who's at the table.
They kicked Chief Spriggs out. He's trying to get the presentation back up. So, hi, good morning. Doug Romali, Fire Chief. With me is Deputy Chief Carol Spriggs. And we're happy to be here this morning to discuss our budget with you. We realize that the fire department budget takes up a lot of the city budget. We know that, we understand that, but we are the emergency services in the city of Annapolis, and that basically everything our department does relates around emergency services. So as you see us go through the budget, I think we'll be able to explain that a little more, and that the pie chart will also show it farther in the presentation. So just so you know about the fire department, we exist to provide a safe environment for the community by minimizing the impact of fire and injury through public education, quality service, emergency preparedness, and overall culture of safety. And safety is our #1 goal throughout our department. This organizational chart is the basic organizational chart that's in the budget. Basically, we fall under the city manager, and then under me is 2 sections. The deputy chief works directly for me, and then we break it down into operations and administration. And throughout that, that's where the emergency services part comes. And then the administrative side is payroll, administration, hiring, that type of stuff. So some highlights for last year, the current budget we're in. Everybody knows that COVID took up a majority of the time for every agency. It was very challenging for us in the fire service. I'm proud to say our employees showed up every day. Every day as we worked through the challenges of COVID, we found that things changed daily, and it changed some of the operations. While we're always prepared to run emergency services and run medical calls, it did change the way with some of our pandemic protocols and some of the ways we were doing business, to include the amount of time it took to decontaminate a medical unit afterwards, and we had to adjust as that went throughout the year. But I'm proud to say that our people came in every day. We did have a bout where COVID hurt our department for some time. You see that currently in this year's budget. We know our overtime costs were up because of that, because of a lot of sick leave. We also had to change the way we're doing things. I can tell you that your firefighter and paramedics would come to work with sniffles before. And then there were times where we'd see somebody come in with sniffles, and 3 shifts later, it's worked through the entire shift. We don't want that anymore. If people are sick, we don't want them to be here. So we understand that, and we do believe that that may increase some of our sick leave. We have dedicated people. They want to come to work, and sometimes they come to work and they're not 100%. But the pandemic has shown us that we can't have them there if they are sick. So with that, for the last 12 years, and I knock on wood every time I say this, we've had no fire fatalities in the city of Annapolis. Our medics and EMTs continue to assist the public with vaccinations. What they did when we did the vaccination and testing clinics and the boosters, we had paramedics and EMTs out there that assisted the emergency management and the health department do that. So we were able to help with all the school teachers. And then we went on to city employees, and we helped with some of the vaccination clinics in the city. We also provided EMS care for the state vaccination clinic that was set up at the stadium for several months. So we did that throughout the pandemic and throughout this last year. We were able to hire 10 new firefighters and paramedics over the last year. They were all replacements. They were not new positions. But when I can tell you with those positions, the one class we hired 5 paramedics, 5 ALS providers. That saves the city because they were paramedics when they came in here. It saves us a lot of money. They came in here as paramedics with Firefighter 2 certifications or Firefighter 1 certification. So we were able to do an enhanced fire school to get them in and out in 12 weeks compared to the normal 6-month fire academy. And because they were already paramedics, that's 18 months of college at minimum $10,000 a piece that we did not have to pay in the city. And as we move forward, you'll see in our goals that having an appropriate number of ALS providers is important for us because it's hard to get paramedics. But there was a good cost savings for us there by hiring those 5 paramedics. We were proud to be able to bring them on board. And then the 5 others were laterals. So they were previously trained firefighters in the career fire department, either firefighters and EMTs, and they came from another jurisdiction that had already paid for their training. So that saves us not only the 6 months of the academy, but also the training costs associated with that. So our department ran over 12,000 incidents last year for fire, EMS, and so on. With that 12,000 incidents, some of those have multiple units on that. So we had 22,000 responses from our stations. So 22,000 pieces of equipment were on call at those 12,000 calls. We had 8,000, close to 9,000 EMS encounters. As you find as we go through our budget, that's what we do. We take sick people to the hospital. It's 70-some% of our operations every day through the year. But we had close to 9,000 EMS encounters, and we took more than 5,500 people to the hospital, collecting $1.7 million worth of funding for EMS. I am proud to say we worked hard over the last year. I know that the finance director is appreciative of this also. We worked with the state, the health department, and our billing company to be able to enhance our EMS billing, and we're bringing in another $1.3 million this budget. So it'll be close to $3 million brought in, and we were able to do that because that's Medicare reimbursement, where we're able to do a supplemental once a year now and actually send it to Medicare for the actual cost involved. Before, they'd only pay $100 per transport. So this will help us. So I just ask that as you look at our budget, I know it's big, I know it's $22 million, but we do everything we can to try to bring that down, and we are bringing in $3 million worth of EMS funding every year, at least this year, and we plan on being the same the next year. So that's important. Your Life Matters program continued to go on. That is part of our opioid intervention that the fire department does, which is part of the overall city initiative that goes along with I guess it's community cares group now, or out of the mayor's office, emergency management, the police department, and us. We all have a part. That's our hands-only CPR and our Narcan Leave Behind program. So we continue to do that. And I know Alderwoman Tierney is happy on this one. With the council's support last year, we moved some positions around, and we were able to hire a full-time fire protection engineer to be here in the city of Annapolis. He works in our fire marshal's office. They're located on Gorman Street, works with planning and zoning on a regular basis to help us with any of our code reviews and any of the issues we run into. So that's important. Every time we had a major fire in the historic district, and we had the groups brought together after that to review our actions and what could be done. Dating back to one of the fires in the 80s, it talked about having a fire protection engineer on staff. We had done it over the years using some contract services. We used third-party contractors at one time, which was not cost-effective for the city or the business owners that were trying to get stuff done. And we're very happy to have this position on board. We think it'll help us with the plans review process. We know one of the things that everybody hears about is, well, sometimes we hear it from contractors, and I hear it on a regular basis, that sometimes the city's not easy to deal with when it comes to plans reviews and the permitting process. And for the fire marshal side and to help planning and zoning, we feel that this person being on staff to answer questions is just going to help enhance that process to eliminate some of those issues. So our goals for the year, what was in the original budget book, is very similar to this, but as you know, the audit committee had a group come in to work with every department about our goals and our how we're going to do that program, our programs. We changed some of them. These are very similar, but these are the ones that are in the current budget that we're asking for now. And it's firefighter safety. Firefighter safety is our #1 goal throughout our department. That's always going to be our primary responsibility. And then we want to provide a safe environment to the community. As you know, and I've been talking about for some time, we want to maintain our minimum staffing of 25 people every day. That's what we need to put our fire engines and our medic units on the street every day. So that continues to be one of our goals. And we're going to continue to try to reduce the number of cancers in the fire service. Cancer in the fire service is becoming a prevalent issue. It's dating back to multiple years of exposure. The things that are built now are built with plastics and carbons and all kinds of different things. And what we're finding is that those items are cancerous. Unfortunately, right after being appointed fire chief and Carol being appointed deputy chief, we lost one of our young lieutenants to cancer who had a family. And so this one hits hard for us, and that's one of our goals. And nationwide, it's becoming an issue in the fire service. We want to continue our outreach programs, and mobile integrated health is something that we will continue to push forward. We know that our healthcare system is struggling, and whatever we can do to help with that. But we'll just go through the performance measures here. The one is firefighter safety. It's to enhance the health and safety of our people. Our objective is to reduce on-the-job injuries, reduce our accidents, which include vehicle accidents, and to look into every single one of them to see if there's things we can do that are causing us these issues and we can correct that. So our benchmarks are reviewing our records for workers' comp and our vehicle accident complaints or concerns and investigations. Excuse me. So our performance measures are just that. We're gonna look at the claims. We used to meet monthly with risk management. Well, we continue to do that on a quarterly basis, and we've been talking to them to see what we can do. We also have changed some of our training programs for vehicle driving, and we look at all of the personnel training files as we move along with that. Goal 2 is, what's that? What were you saying? Oh, I'm good. The number 2 goal is to provide that safe environment to the community. It's to minimize the impact of fire and EMS or accidents and injuries as per our goal, that our mission statement. Our benchmarks are the losses we have over the years, but our performance measures are those national standards that we run into, and that's to get a unit on scene within 4 minutes of dispatch 90% of the time, to get an ALS person on there. And when I say ALS, that's a paramedic. It's advanced life support provider on scene within 8 minutes. And when we talk about the initial alarm assignment, that's for a structure fire. That's to have at least 15 people on scene within 8 minutes. And we track that on a monthly basis. I'm proud to say that we meet those standards. I know one of the older people sitting in front of us had a concern. We do it 90% of the time. We always want to improve about that 10% of the time. And anytime we have an issue, we look into it and try to determine what has delayed our responses. So I just want to assure you that we continue to do that. But we are meeting that standards. For the ALS provider to be on scene, we have them there within 4 minutes typically. So that's half the national average, and we're proud to be able to do that. And obviously, we want to maintain our ISO Class 1 rating, which is done through the insurance industry. And they give us that rating. It's an outside bureau that comes in and rates the department. They rate it 1 to 10, 1 being top-notch fire service, and 10 being very little fire service, and we are a Class 1 department. Go ahead.
Our third goal is to maintain our total daily staffing for the operations platoons of the department. And along with that, we want to increase our ALS daily staffing. So obviously, as the boss mentioned earlier, it takes us 25 people to run during the day, each day in the city of Annapolis. So our benchmarks to measure that are our benchmarks to have a fully staffed fire department. And a way that we measure that is by monitoring the number of soft openings. We can't predict when our personnel are going to be out sick or injured. We can't predict when some of our female employees are going to become pregnant. So we count those as soft openings, or military deployments. We count those as soft openings, things that we can't fill. So that's one way that we measure those. And then another performance measure is the number of ALS providers that we have on each shift. We believe that ultimately having 12 paramedics per shift will allow us to function effectively and efficiently. And now we're around 9 or 10 per shift. And so we're constantly encouraging folks to seek training to become paramedics, and also recruiting. We're constantly recruiting to try and get paramedics on staff. The chief mentioned cancer awareness and prevention, and it is a huge concern for fire departments across the country. And so our objective is to reduce the number of cancer cases in our department, and then to continue to educate our personnel on ways to prevent cancer. A benchmark for that is to have no one in the department suffering from cancer. And there's certain presumptive cancers that are out there, and we're just going to track the number of cancer cases that we've experienced in the department. We're going to educate our folks. One of the big things that's occurring now is with foam, and there's some bills that were just passed in the last legislative session with regard to some cancer-causing agents that have been present in the foam that we've used for years. And so we're no longer able to utilize that foam. And that's an issue because we know that several folks have been exposed to that for years. And so obviously we're going to take whatever measures we can to prevent the use of those agents, as well as some of the cancer-causing agents that are now found in the protective equipment that we wear. And so we realize that's going to be a problem going forward as well, not just here in the city of Annapolis, but nationwide. And so we're doing everything we can to research and provide better personal protective equipment for our people as well. Our fifth goal is to provide community outreach programs through public education and to reach more city residents in fire prevention and EMS skills. So we try and have hands-on CPR and in the city events that are occurring. I know we did it in the past Martin Luther King festivities. We're going to do it in the Juneteenth celebration at Bates. And we visited various communities just doing hands-on CPR and Narcan leave behind, all in coordination with the Office of Emergency Management and Your Life Matters and things that the boss mentioned before. So the way that we track that, or way that we measure our performance is we just track the number of times that we do that. Unfortunately, the pandemic did not allow us to do them as frequently as we would have liked in 2022 and 2021. However, we have started to pick back up in the number of classes and the number of events that we're participating in. And we're proud to say that we've been able to do that in English and in Spanish so that we can reach everyone within our community. Mobile integrated health is another goal that we have, and that's, I think, the wave of the future. And when we say mobile integrated health, it's just thinking outside the box. Our hospital wait times have increased tremendously over the years. At the beginning of the pandemic, they did trend downward a little bit because folks weren't going to the hospital. No one wanted to leave home. Everyone was worried about catching COVID. And so when someone went to the hospital or when someone called 911, they were really, really sick and they really needed to be transported to the hospital. We've seen our call volume increase as the pandemic has slowed down a little bit. And unfortunately, that results in increased wait times in the emergency room. And so one of the ways that we are trying to beat that is with this mobile integrated health program. And this includes things like transporting patients to alternative destinations. One of those being Patient First, which is obviously not a hospital. It's like an urgent care center, but we have patients that meet a certain criteria. With their consent, we can take them to this alternative destination where they can receive definitive care and not have to wait at a hospital. So we track that by counting the number of patients that we have transported to these alternative destinations. And then another program that we're doing, or that we intend to do, we've gotten approval through MIMS, is our Telehealth Program, which is where you can actually have a patient see a doctor while they're in their own home with our paramedics on an iPad or on a laptop and do a virtual office visit right in their home. And then the doctor can send a prescription or send whatever their treatment plan is right through the internet. And that person never has to be transported to the hospital, but they're still receiving definitive care. And so a way for us to track that also is to count the number of times that we've done that, and then overall decrease wait times for not just the people that we transport, but for other people throughout the community as well.
So we found with this mobile integrated health program, it's going to take years to get there. People are not inclined to go to Patient First. You can call them a doc in a box, you can call them to whatever. We are having a difficult time with that program, and people aren't used to it. So it's going to be a big educational push for us. We don't know if it's going to work. We are one of very few jurisdictions in the state of Maryland that have been given the authority to try this. We do some other things direct to triage. Instead of going into the emergency room, we take somebody and take them to the triage area. But this is just a program that, it's like Chief Spriggs said, it's the wave of the future, but it's something to help relieve some of the healthcare issues that are out there. So it's a challenge for us. I don't know. The telehealth is been working well for a lot of doctors, but when medics show up on a scene and you tell them you want to do telehealth with a doctor, sometimes people are leery of that too. So we don't know how the program's going to go, but we want to try it because we know we have to eliminate some of the, or help alleviate some of the issues with the healthcare system. So our long-term goals, eventually we want to go back to getting accredited through another agency besides our ISO Class 1 certification, but this is just a long-term goal. Mental health, while we do it now, we really want to look at that. Suicide prevention and mental health of our providers is important. Throughout the United States, we've had a lot of first responders that have taken their own lives. We are very fortunate in the state of Maryland that the International Association of Firefighters has a Center of Excellence, which is a mental health and substance abuse center right here in Maryland, in Prince George's County, that are providers that are struggling with that type of issue or post-traumatic stress can go there. And we have programs within our department. We have a peer support group within it. We have a critical incident stress management team that's led up by a battalion chief. And we have a mental health professional doctor who is contracted to help us with that program. So we take that very seriously, but that's going to continue to be one of our long-term goals. We already talked about the mobile integrated health. I don't think we need to go over that again. And then the upgrades to the city fire stations need to continue. We've been working hard to upgrade the Eastport Fire Station. As most of you are aware, at one point there was talk about knocking the building down. We know that building's not going anywhere. So anybody who's been in the building has seen some of the upgrades, have used the meeting hall or the meeting room there. The female facilities were upgraded, but with that station, the male facilities are falling apart, that type of thing. But with like the Forest Drive station, it's built into the overall project with the public works facility, but the female restrooms or female facilities in that station are terrible. We had to convert a single stall restroom in the engine bay that was there for the public into the female facilities. And we have 20 to 25 females working within the department. So it's not like you only have one female in the station. It sometimes becomes challenging. And our buildings were built in the 60s and 70s, and we want to continue to enhance that to make it a good place for our people to be working and not run into any issues there. So they're just part of our long-term goals. The performance measures, what's worked for us so far. Then this goes into, we talked about our new performance measures. But as you can see, the performance measures that are up there are the old ones that are still in there, because that will continue. Because the only way for us to really tell whether we're doing well is the number of fires we're having, the fire loss in the city, and the amount of time it's taking us to get to calls. So what worked well for us in our current ones are we're meeting that national standard that we talked about. Overall, from the time our people get on the apparatus or on a medic unit, they're typically at a scene within 3 minutes of the time they're leaving the station. So there's that 4-minute goal. So it typically is that three minutes. There doesn't include the time to call 911 and get it dispatched, but that's from the time our people get on the unit, get the call at the station, and get to the scene. As I told you before, it's the 8-minute national goal to get a paramedic on a scene. We get people there within 4 minutes. That's an advanced life support provider. We're averaging 5.5 to 6 minutes to get that 15 people on the scene of a structure fire. Over the last 2 years, we have maintained that minimum staffing of 25, and we've completed with the law office some of our legal aspects to be able to take those people to those alternative care facilities, because there's legal drafting that had to go with that. What really hasn't worked for us was that ALS rotation. We know we need at least 12 paramedics per shift. We need our paramedics to get time off of a medic unit to enhance their skills on the other side of everything we do, because it's all-encompassing department. We don't just have people that are medics, and we don't have people that are firefighters. They have to wear those multiple hats. So that hasn't worked well for us. We had to revamp that program and leave it up to each individual shift battalion chief to determine who gets off the unit at what time, and they manage that program. So with that was the hiring of ALS providers. It's hard for us to get ALS providers. It's a national issue. And then controlling wait times at the hospital. We don't have a lot of control over that, and that hasn't worked well for us. So here's what you're looking for, the big parts of the budget. So our salaries appear to have a pretty good jump. We get our numbers for our salaries and benefits comes from finance. It doesn't come from us. And as you know, over the last few years, and the finance director can correct me if I'm wrong, but we've been upping the amount going into the pension plan to get where the actuaries and the people tell us we need to be. So there's been an increase there. With our department, there are some increases in steps, or in, not steps, but actually the promotions of the individuals. So there's firefighter 1, firefighter 2, firefighter 3. So that's not like the other positions where we're only allotted so many firefighter first class positions, so many lieutenant positions, so many captain positions. All the firefighters are lumped into one big pool. But within their contract and the way it works, as they get certain training and have 3 years on the job, they automatically get promoted to a firefighter 3. So we believe, because we've become a department that, I can't say younger because that's not appropriate, but we don't have a department that has a ton of people with 25 years or more on it. We have people that have 1 to 5 years, and we see that as also a national trend with the people we're hiring. We're finding people that will leave one department and go to another. It's you can call it a generational thing. It's just the challenges of today. But as I said, we do that and we bring the new people on board. Within that first 4 years, they jump in rank. So with that comes pay increase with those. So we believe that that's part of it. And also, as you know, the city gave a 3% raise last year. So we believe that that's the ultimate cause of the increase in our salaries. And plus, there is one additional position that we put in for this year, and it's a very important position that we need to have. We had an external group come in and look at our quality assurance program. So we work under the state of Maryland MIMS, it's Maryland Institute for Emergency Medical Services Systems, certifies all of our medics and our EMTs. So that's where we get our certifications from. We work under a medical director. So we have a medical director that's contracted with us, who is our medical director in the city. We work under his license. But with it, there's a lot of healthcare requirements that go along with our certifications. And part of that is 100% quality assurance of all our EMS care reports, to make sure that we're not violating protocols, that we're not having issues. And plus, we're supposed to have a program that finds trends and see how we can improve those trends. So say our cardiac arrest survival rate for whatever reason over the last year has dropped, to try to figure out why that has occurred. As I told you before, our members, our employees, our firefighters and medics are the best part and the best kept secret in the city of Annapolis because they wear so many hats. That's why we can provide all the services we do. But we know as we put more services on there and we get them to do these specialty things, sometimes things fall a little behind. EMS is 70 to 80% of what we do. I have an EMS captain in that position. And because of the issues over the last few years with COVID, the pandemic, all these changes with the hospital care, with the EMS billing and requirements there, our quality assurance program, as we looked at it, is not where it needs to be. And we need a supervisor to be in charge of that program, and that's what this is. And it's sort of being mandated by MIMS. We have to do it. We don't have an area within the city fire department where we can take a person from operations and put in there, because like Chief Spriggs talked earlier, we need 25 people working every day. We have 30 people on each shift. So with that, you have 3 to 4 annual leave spots every day. So that takes you down to 26. You get one person on sick leave, or one person on educational leave, or one person on FMLA, especially long term, we're automatically paying overtime. So if we were trying to take one of those positions off those 4 shifts, it's just going to create us more overtime. Plus, with it being the majority of what we do, taking people to the hospital, we need that position. So part of that is a supervisor's position, which is a lieutenant within our department. And we looked, we actually talked to the city manager about this too, about whether it's more cost effective to bring in a civilian to do that program for us. But the way we operate, and we believe it needs to be a supervisor. It is the best way for us to do it. Looking at the jurisdictions around us, they have supervisors in that position. So we need to take a supervisor and put an EMS with our captain, and that is the one increased position that is in the budget. We needed to stay within the budget for multiple different reasons. And if anybody wants to talk offline, we can discuss that too. But our quality improvement and quality assurance program for our EMS reporting, we're revamping it. We are already in the process of doing it. We can't wait until July to get it started. We had some mandates from MEMS that were sent down to us, but we were already well ahead of it. And we're just going to make us even better than what we are. But we need that. And that's part of that salary and benefits that's in there, because it's a lieutenant's position, which is probably $100,000 because they're a supervisor. And then with their benefits, it's, that it's up there. So, but it's one of our first line supervisor positions. So we're not hiring another chief or another captain to do that. It's a first line supervisor we want to put in there to do that position. So I know that a couple of the older people were wondering about that jump. That's the only thing we can explain there is that it's not like we've done anything extra beyond what was allotted in the budget. So contract services, you're going to see an increase in contract services. Part of that is the mandates from the Maryland Police Training Commission. We have seven law enforcement officers assigned to the fire department that are in our investigation section. With that, all these police reform bills that are out there apply to us. We're working with the police department to do that, but in the contract services, that's the psychological evaluations that are going to have to be done every year. We already do annual physical for our people, so that's not a problem. That was already within our budget, but part of that increase is that service there. Supplies, mainly in the supplies account, you're just going to see a 3% inflation, and as we move a couple slides down, you'll see how much costs are going up for us. And then the big increase is the capital outlay. A majority of that is one-time cost, and why don't you go to the next slide? I'll provide it. So this is the pie chart that you were asking about. As you can see, 92% or 91.6% is all salaries and benefits. And we know that. We have very little operating funds when it comes to managing 3.5 fire stations. And to do that, we feel we do an excellent job with what we have. The equipment that we give our providers is top notch. If you see them on the street, you'll know that. We continue to enhance it as we can. But our goal is to get people on the street to meet the demands of the community every day, and that's in our people. We get asked all the time, well, why do you have this many firefighters and there's so many police officers in the city? Well, the police department has some different ways they can do things with crime lab, with their administrative tasks. The police department has 25 more positions than we do, so it's not like the positions. I think people just look at firefighters and police officers, and it's just totally different how we do things. Our support staff is a staff of like 5 people. We have Jeannie, who is my assistant. We have 2 office associates at headquarters, 1 office associate in the fire marshal's office to handle the plans and the contractors that call in there, and 2 civilian fire inspectors. So majority of what we have are uniformed people, and that's the way we get the best bang for our buck. But that's why our budget is what it is. If you take out, you'll see in our budget there's 600 and I don't have the exact number in front of me, but like about 640,000, maybe higher, for fleet services. Well, that's how, if you remember, that the city changed the way we did fleet services, and they're taking it out of each individual department to help pay for the fleet manager and the mechanics, because they fall under public works. So that automatically comes between that and fuel costs. So you take that out of what's not our personnel cost, it gets us right down to, well, with this year, with our one-time costs, we've got $1 million something in there, but that there are fire departments out there, volunteer fire companies, that single stations that budget more than $1 million a year for all of their, no personnel costs for everything they need to do. So I'm here to assure you that we're doing the best bang for our buck, and we realize that we're the stewards of taxpayers' money, and we know we cost a lot, and we're an insurance policy nobody wants to pay for, but I can tell you when we're needed, we're there, and we're there to help. So this is just the differences that we were talking about earlier. Our overtime cost to maintain our staffing at the 25, that is part of our actual cost. We know we were only budgeted at $645,000. Throughout the last couple of years, we have been using some of the monies that were sent in because of COVID to help us assist with that, because our sick leave was up because we had so many people out. I am proud to say we are fully staffed. That helps with it, but the $204,000, we need that to continue to maintain that minimum staffing at 25. When we have those soft vacancies that Chief Spriggs was talking about, we have a firefighter now that's out on an injury. He's going to have surgery. So we're talking several months that person's not in the field. We've had one of our higher level chief officers that's been out for 8 months with FMLA. So we have multiple people out for multiple different reasons. So that plays factor. And it's not like there's any cost savings there, because we have to pay those individuals. They get their salary, they get their sick leave that they've earned, which they're entitled to, and they earned it because we want to get them back to work and get them healthy. But there's the only way for us to fill their position basically is overtime, because there is no real fluff. There's no extra people just floating around in the fire department. And because everybody's in operations, that's the majority of it. So that's there between our salaries and the overtime costs there. The benefits, finance can tell you the difference in benefits, but that all plays in there. So the $10,000 basically falls into the employee physicals. That's the cost it's going to cost us to do the psychologicals for our 7 individuals. So you see that's for our 7. So as you get to the police department's budget and they talk about this police reform, they're paying the same thing we are. So that's going to be a big impact for them. We have no control over the heating and electricity. But that's a very, those increases there are just at 3% for inflation. You can go on to the next one. Yeah, it's the same way here. Our contract services, yeah, it's just the ongoing increases what's cost us. So our contract services, part of that is, I don't know if it's been explained or not, some of this is not new money. Some of this money is being transferred. It was originally in IT's budget. So it's my understanding this year that they are taking the employees for each department, the Google Suites that we use for our computers and our emails, it's all being charged to departments now, where IT was paying for it before. They've shifted that money out of IT and gone into the department. So that's part of the increase you see, but that's not really new monies. That's just coming from one department to another. All those other minor increases are the 3% inflation cost. And I'll talk a little bit about the capital outlay. So if you go to the changes, here's the changes we talked about. The quality insurance officer is going to cost us about $150,000. That's a lieutenant's position. That's salaries, benefits, the vehicle, the radio, that type of stuff. The one-time funds in the capital outlay, there's $225,000 in there for station alerting systems for all of our fire stations. So it's part of the tax differential also between us and the county, but the county provides 911 fire dispatch services for us. So they do our dispatching. Dispatching is computer generated, comes to the stations. The county, we have it's called a tone generator. So over the airways, they send out the call. It opens up a pager. That tone generator opens up the pager, and then they dispatch the call. Well, that tone generator is old and antiquated. The county is changing the way they're doing dispatching. So the county is going to run the server into the building and the service, and they will continue to pay for that. But everything else within the buildings has to be covered by us, and it's a one-time cost. This isn't going to be an ongoing cost. This is just a one-time. There'll actually be screens up in the station where the calls come to the screens. It's actually some of our mental health or some of our physical aspects for our firefighters. Right now, you go from 0 to 100 when that pager goes off. It's a soft tone, and it opens up, and the lights come on, and they come on. They don't come on real bright. They move their way up to a certain brightness when a call comes out. There's a different color light for an EMS call than a fire call. There's a whole bunch that goes along with it, even into some safety aspects. And I know you can find this hard to believe, but every now and then there's fires in fire stations. And every now and then, like one of the leading causes of fires in the nation is food on the stove. Sometimes we get a call and the stove may not be turned off. The alerting system comes off, it'll turn off it's got the ability to turn off the gas to the stove and the gas to the propane tanks outside and that type of stuff. But it is a one-time cost. It's something we have to do. We have to be able to get the calls. We have to be able to get the information. The county's providing us the basics. It's going to cost about $75,000 worth of upgrades to our stations. But just to put it into, just to bring it, around full circle, the county's got to do this to 30-some of their stations. So that's why they're bringing the service to us, but any of the other stuff that goes along with it, we've got to cover. So that's the biggest part of it, but that is definitely a one-time cost, but it's something we have to do because the county's upgrading that. They've been upgrading the radio system for some time. Hazmat ID, it's like anything else, and I know it's hard to believe that a handheld monitor can cost $90,000, but this is a chemical monitor that can detect multiple different types of chemicals out there, powders, and the ones we have are outdated. It's no longer supported, and it needs to be replaced within the hazmat unit. And that's a one-time cost also. And then the $60,000 for gym equipment. The Taylor Avenue station was built in the 80s. The gym equipment that was in there was purchased in the 80s. It is not state-of-the-art. It's a lot of dumbbells and some other things, and it's just the upgrades that have been requested for our physical fitness program. Now, we've worked with Rex and Parks. We've talked to them to see if they have any surplus items. We're moving some treadmills around and working with them, but this is just to update the one fire station with the gym equipment. So that's there. We talked about the $7,000 per person for the state mandate, and then the fund transfer from IT for the Google Suite. So that's the biggest part of the change in our budget. There is one additional person in there. I know that that's sometimes hard when you're trying to add to your agency, but it is a very important part of our department. Like I said, 70 to 80% of what we do is EMS. We have one captain in there that falls under a battalion chief, and we have to have one person that just oversees this program. And they will be doing other things. They will be looking for trends. They will be doing training. So if we're finding we have issues, they will be coming up with training to fix concerns we have about trends in the department. They'll be looking for areas that we need to improve. They will be making sure that every report that's reviewed by our lieutenants or our EMS supervisors, that we're QAing or we're checking their reports to make sure everything's being done, because we found that there's been a couple of times where things have fallen off the plate, and when things should have been picked up, they maybe weren't. So we're going to correct that with this position. So we've said a lot so far. We can go into any questions you have. Well, obviously, we have a lot of data when it comes to our station responses. I know I have a list of questions that after you get through yours, I can go over that one of the older persons brought up. I think I addressed some of it already, but we can go through those after. So it's up to you, Madam Chair. Let us know.
Sure. Yeah, thank you so much. And I think that it does demonstrate your due diligence with your budget, knowing that you really truly are a service department, and it is your staff, and it represents, and it appears that you're managing the rest of it very well. Being only 9% of your budget has to address the other stuff, which, so I do commend you on that. Again, what we're going to do here is my colleagues have questions, and they'll be allowed to ask questions, Q&A, and then on the committee, and then my other colleagues will have 5 minutes each, and then we'll rotate again 5 minutes so they have equal time. So I'll go first because my questions are just pretty general, and I know that and Alderman Savage's questions I'll ask later. In developing your budget line items, could you speak to whether or not you evaluated a pattern of past expenditures? Could you talk to how you developed your forecasts in your budget line items? Did you?
So we look at the supplies we go through every year, and what we have found is that the increase in medical supplies and how much, do you remember how much it is for the turnout gear?
The increase for turnout gear alone was, I think, greater than 17%. And it's unfortunately, lots of things are being blamed on COVID, and there's just no way around that for us. So we didn't go as high as that. I think we did a 3% across the board increase, and are hoping to be able to smooth it that way.
So our firefighter protective gear, that their ensemble that they wear, from their boots to their turnout pants to their jackets to their gloves and helmets, have to be replaced every 10 years. Our ballistic vests that we provide on the units for violent scenes have to be replaced every 5 years. So we are on a continual rotation for that. And anytime we get a working incident where their gear gets contaminated or it gets holes in it, we have to replace that. Ultimately, because of our cancer initiative program, we'd like to have 2 sets of gear for everybody. We're trying to do that through grants. But the way we handle it is if they go to a working structure fire now, they come out, they get cleaned off right away, because if you do a gross decon, you get 90% of it off. But then they have to go to our logistics officer and get spare gear out of logistics while they wash theirs. So we have just washers, dryers within the stations that actually take those chemicals out, extractors, takes those chemicals out and cleans their gear. So we do everything we can to maintain what we have. But those costs, especially medical costs and the cost of the PPE, have just increased so much. And like Chief Spriggs said, that increase is high. We only ask for the 3%. We try to manage everything, and then we look for every opportunity we can for grants. And as you know, we've gotten multiple grants. So like our SCBA that had to be replaced, with the council's help, they allotted $900,000 in the last budget to do that budget prior, which we needed to do all at one time because we couldn't piecemeal it. We couldn't have one firefighter wearing one SCBA and somebody wearing something totally different because of safety. But we were able to go out and get some federal fundings. And if you remember last year, we were able to bring in $500,000 to go towards that. So instead of costing the city $900,000, it only cost us $400,000. So we continue to do that with everything we do, and we do that with some of our supplies.
So the 3% was inflation, basically. I was confused when you went over changes and explained, and Director Dickinson might help me with this, that you had an add in indirects, if you will, and you looked at Director Dickinson on what that was, but I don't understand how that's a one-time expense. I mean, if it's an allocation of indirects, isn't that part of recurring staff?
So when he was talking, you're talking about Gmail, the Google Suites? That is not a one-time. I don't think he characterized that. As he was trying to explain why his operating budget has gone up on that line item, contract services.
Yeah.
And part of that is because of that new allocation that had been absorbed in MIT. So we're spreading it out. If you look at their budget on page 80, when we give a breakdown of every item that's in contract services, you see the Gmail allocation on there.
Okay.
Right.
So it's a one.
It is a continuing expense.
Continuing expense. Okay.
The other items, the station alerting system, those type of things, and the monitor is a one-time expense.
Okay. And lastly, I'm trying to equate your requests to your performance measures. It's in that if you're asking for something, is it because of a deficiency in meeting performance measures, which logically would make sense, or is it mission essential? So, for example, adding that one position, it sounded like it was a mandated. It was mandated, but then does it address a deficiency in that you're not able to meet a performance standard?
It would be part of the goal number 2, the performance standard of the safe environment for the community.
Oh,
yes.
Okay. That's pretty good. Where does it say that?
So the goal 2, which is one of our performance
Okay.
measures,
That was a
is
great answer.
to provide safe environment to the community, and that position is that.
Wow, yeah,
Yep.
that's like how it should work. You know, you ask for something, it's to meet a deficiency. And then, of course, the inverse is true, is not very often, though.
So the station alerting system would fall under the same goal, it would be a deficiency if we weren't able to get our calls appropriately through the county because the system's changed, that would become a problem for that goal.
Thank you so much. Questions?
Yeah, I have several.
Yeah, of course. Alderwoman Finlayson.
Just a few questions. While we're talking about your changes, are they actually your enhancements for this year?
So they are.
Okay.
We're very diligent. We've gone, as you know, I've been through many budget processes.
I just want to be clear that they're in here.
They are in there.
Sometimes they're not in the past, so
they are.
I just want to be clear. So
Yes.
these are your enhancements.
They are our enhancements.
Okay. A breakdown of your representation by race, gender, is that here? I didn't see that.
It is not there, but we'll send it out to you.
Okay, I would appreciate that. You talked about on paramedics, the fact that you'd like to have 2 or 3 more trained paramedics on each shift. Do you have people that could be trained and thus would leave a vacancy at a different level that might not be as expensive for us?
So, no, because once they become ALS providers, we have to pay them that ALS pay. So it's not going to save us by moving them up. I mean, we're going to have to pay them either way for their certification, but we stay within the numbers within the department. So of our goals, we want to have 12 ALS providers per shift. Right now, that ALS provider might be a firefighter slot. That's not an ALS position. So it's just that person increases. So to get it ALS providers, it costs us more because we pay the medics more. But we currently have 2 people in paramedic school. It takes 18 months to 2 years to get them through that. It's a college program. It's at least $10,000, if not more. But while they're in class, we have to backfill their positions. But it's not like when we're talking about having 12 ALS providers per shift, we're not asking to add additional paramedics to our overall complement. We just, within our complement, we want to get to that position.
Okay.
So as we hire, so if a vacancy were to come open now, we would try to find an ALS provider to fill that spot before we went to a firefighter. Sometimes that's challenging for us. You were talking about the demographics of our department. We're very proud about the diversity within our department, but by hiring previously trained sometimes is a challenge to us. And we're very diligent when we look at that, and we do our best to make sure we're not leaving anybody out. But to find them that are already trained as paramedics is sometimes hard because they're in high demand.
Do you have and thank you for your ability to cross-train. I know that's an important piece in your department because they have to be able to wear different hats. And so, that initiative has paid off and will always. Have you looked at years of service? For example, how many people are in that first 5-year period? All the way up to how many are at 20? So that you can see, or 25, I'm sorry, how many can you expect to be leaving within the next 2, 3, 5 years? I know you don't want that, but reality sets in. So how many are you expecting to lose? Excuse me. So that we can prepare for that. Everybody's going to be moving up a step. But at some point, could we be doing something on the upper end of the scale to keep them, in addition to what we could be doing at the front end of the scale to encourage them to stay also? I mean, it's retention is what we're talking about.
No, we completely understand the question. And I think sometimes it's difficult because we can't predict when certain folks are going to leave. And I'll give you an example. We had a gentleman that worked for us for 2 or 3 years. It was a firefighter paramedic, and is very happy working here. However, his wife was in the military, and so she was reassigned or restationed to Hawaii. And so obviously he wanted to travel with
You
his
think
wife.
that was a choice, huh?
Yeah, so he came to us and reluctantly resigned because he had to move away with his wife. And he fully expects to move back to Maryland when her 3-year deployment is over. And we can only hope that we have a position when he returns, but we can't obviously hold a position for him. So that's just one example of how it's difficult to predict. Now, we do have the drop. And so in years past, we've known when some of our folks that are more senior or have more than 20 to 25 years of service are going to leave, and we would know if some of those were ALS providers. Currently, we have, I think, 2 people in the drop. One is an ALS provider and one is not an ALS provider. And so we're able to track, the one, we can tell you that employee, will be leaving in 3 years. And so, we know that we're going to lose an ALS provider then, and we can plan for that. But for some of the others, we can't plan for promotional processes. We don't limit, who can participate in the processes if they meet certain requirements. And lots of times, some of our ALS providers test really, really well, and as such, they go through that promotional process and they're promoted. And sometimes when they're promoted off of the paramedic units and onto suppression pieces. And so we really can't predict, who's going to fare out well in those promotional processes. But we have to honor the collective bargaining agreement that we have with the local with regard to the promotional process. And so sometimes that pulls some of our ALS providers away as well.
And if I can add to that, we do a very good job with realizing competitive salaries around us. Our salaries are relatively competitive, but we do have the ability, and as I talked earlier about some of the jumps in our budget, that people within the first 5 years get to jump in grades as they get additional training. And that helps us to keep the people here, because within that first 5 years, now they're getting the majority of their salaries in those first so many years, and then it slows down after that. But that helps us, because once you get to that 6 and 7 year mark is where we find people, it's really a discussion on whether or not it's the grass is greener, or it's even for our laterals coming over. You get to that 7 year mark, it's that hard, that's at that point. So we try to make sure our people are taken care of as much as we can fiscally and responsibly within our budget to keep them here. And we don't have a large turnover, and turnover is always a big concern when it comes to our budget, because we don't have that large turnover. Actually, us hiring 10 people last year was out of the norm for us. So we don't usually have to hire that many people throughout the year, but yeah, we do constantly look at that. But currently, I think we do, compared to other jurisdictions around us, we fare well, and we have a lot to offer.
I don't know what it is about the year 7, because in education, it's the exact same thing.
Yeah.
That's when teachers start to get out of the profession. And yeah, we'll call it the 7-year itch, but it's across the board. So, that's interesting. And that's when employers like us try to look at, what you can do to keep those employees at that time, because it's coming. But it sounds like you have your finger on the pulse of who's coming and who's going, and the potential for vacancy. So thank you for sharing that. I didn't understand something about the phone that you said, dealing with cancer. Is there, these are not the new, 800 megahertz radios? I don't know what we're using now.
Well, he was talking about foam, FOAM, not a phone, not a handheld phone.
Okay.
So foam is used for hydrocarbon fires, gasoline fires, petroleum fires,
foam.
that type of thing, boat fires. What they found is that there were some chemicals in the foam that was causing cancers. Just over the last 2 years, some of our delegates and senators have really pushed to make sure that stuff gets taken out. And what they've actually found is some of these PFOBs, as they call it, are in some of our turnout gear. So our protective clothing that's out there has small amounts of it, but that's what he was talking about, foam. And we just
Okay.
have to change some of the way we're delivering or putting out fires and going to some more environmentally safe stuff, which means it's more expensive and you got to use more of it. But that's part of the cancer initiative.
But is the anti-cancer foam available? Or is it just too expensive, or?
So the foam is available. The question is how you get rid of what you currently have on hand. It doesn't violate any rules, but it's more about the environment and to keep it out of the waterways and things like that when it comes to the foam that we're using. So yeah, we're in the process of changing over. We're changing it over through that, and we work with the state and the Maryland Department of the Environment to assure that we're not violating any environmental laws as we do
Okay,
it.
great, thank you. Have we met with Luminous? And I'm getting to your wait time at the hospital, at the medical center. I know that's been a problem.
So
And now that it's under new management, ownership, whatever, have you had an opportunity to share with them the position it puts us in, having to keep our paramedics there for extended time?
we have met. They are well aware. They constantly try to make changes within the emergency department at the hospital. Chief Spriggs and the county's assistant chief, who is their operations chief, sometimes actually go out to the hospital and we have units there for a time. What we're finding is when our medic units go on a call, their average time is that they're gone is over an hour. Unfortunately, that's pretty well normed. It's right around that hour mark, whether it's Anne Arundel Medical Center, whether it's BWMC Hospital, which is our next closest, or we'll go to doctors, we'll go to Laurel. Now, we do have one of those occasions when you hear us talking about these long wait times where we've had medic units for 2-3 hours. But when you average it out amongst all the units and all the times, we average about an hour. So it's staying pretty consistent right now. It's not quite as bad, but we do have those days where when we have units out of service for 2-3 hours, it's bad. And some of our public gets extremely mad when we tell them we're going to Prince George's County to a hospital or we're taking you to Queen Anne's County. And that's some of the thing with we have an agreement with MedStar, which is old right time. And, I always see it as right time pediatrics as I was growing up. Well, it's not right time pediatrics anymore. It's actually MedStar Health Services. But there's several things that go along with that. They have to be a lower acuity patient. Plus, they have to have a ride home and that type of stuff. And sometimes when we tell family members we're going to other hospitals, they get really upset. But I can tell you that our local hospital, Anne Arundel Medical Center, used to be Anne Arundel General right downtown, is not necessarily the local community hospital just because it is so busy. And any time of the day you can go in there and you can see 3 or 4 Prince George County medic units at that hospital. So it's not just Luminous. It's not just Anne Arundel Medical Center. It's across the board. So we do everything's daily. The medics can go right up on their computers and they can see what hospitals are on alert so that they can make the determinations. Our EMS supervisors, but the deputy and the county assistant chief have gone over to the hospital and helped push people around in wheelchairs and move stuff around to get our units out of the hospital. They are receptive. They know it's an overall health problem, and they're not trying to harm us in any way, and they are working with us.
Your alternative destinations, I assume we've gotten whatever authority we have or is needed to go into these alternative sites?
So the only alternative destination we can transport to is the MedStar, which is the old Right Time Pediatrics. That's the one we have the authority to do it with. That's where we had met with the law office, got all the approvals done. But it's a kind of protocol is it called when you do a optional protocol that we had to apply for. So yes, we have the authority under state mandates to be able to do it. We are one of only a few jurisdictions that are doing it. But what we have found is the challenges we're having, the other jurisdictions are having the same thing, that people just tend to don't have a tendency to want to go there when they call 911.
There are several right on West Street.
There are, but currently the only
So-
agreement we have is with MedStar.
Okay,
So,
so-
and some of that is the requirements on the facility to be able to do certain procedures, the x-rays, so the agreements are there. And right now, we just started with the one. We are still early on in this process, so we'll see how it goes. But yeah, the Patient First facility right at Western Route 2 looks like a great
Right.
facility. Actually, I know my family's used it once or twice, but we don't have an agreement with them currently. And
I have used it.
yeah, so
And my doctor sent me there instead of over to the medical center.
Yeah.
And it was a lot faster. I'm just saying.
we're with you. We understand.
Suicide prevention. I know that the county has more of an issue, I'll just say, with suicide prevention. We don't, other than, well, we don't have the same type of problem. So do you, and I guess this gets, well, maybe not, do we have, is it, trying to think of the program where we bring in, I lost my words.
Mobile crisis.
Yes, thank you.
So mobile crisis is available to us if we need them. But as I sort of brought out earlier, we have our own people that have been taught in critical incident stress management, which involves peer support. And peer support is personnel from multiple different levels within the department, and they're trained to look for certain observations, to talk to people, to get them in the right place. If we have any concerns about any of our employees, we obviously talk to them. It's in confidence. We utilize the city's employee assistance program when needed. But for us, because we have the mental health professional assigned to us, he is a good help. I talked about the Center of Health in Prince George's County, and then there's a place in Shady Grove that works with first responders. So we have the ability. We've worked with, and we've had several of our personnel, because, and I'm not saying that COVID is the blame for everything, but the stresses that's been put on our people and their families, we've had several people struggling. And we do. We ask our providers, and it's us too, because we go out with them, to go out and see things and have to deal with things that most people shouldn't have to deal with. And some of it's not good. And especially when it comes to kids, it's hard. So we're doing our best to make sure the mental health of our people are taken care of. So we're always looking, but we have those sleepers out there. But we're just worried about the trend that's out there with the suicide. So we want to continue to do that with our mental health programs that we have. But mobile crisis is available. All we have to do is pick up the phone, and they will come out and assist us also.
We've had our tragedies in the city, and that's the, the genesis of my question, to make sure that we are trying to take care of our family. So, contract services, police is my question. How many police officers do you have on your roster?
So
Like
essentially, there
Mr. Spriggs and Deputy Spriggs, I suspect is
essentially
one of
there
those.
are 7 that are sworn law enforcement, but 2 of us are sitting right here because
Okay.
we still maintain our certifications. But for the most part, and one was just transferred out of investigations, is now the station captain of the station. But what we have is we have 4 investigators, so we have 4 shifts. So we basically have an investigator for that, and our investigators have to handle all fire investigations. They also do our explosive services stuff, which is just an added hat to them. We have to have fire investigators, so that's just part of what they do. So they're the bomb techs. They have the explosive detection canines, but fire and explosives investigations is the bulk of it. So it's like anything else. We preach safety, so we have to have 2 investigators on scene. But basically, it's 4 investigators, one basically for a shift, and then we have 1 supervisor for them. So it's the 5 of them. That's their primary functions. The supervisor, the investigators work certain shifts, and then the supervisor's on day shift, and the supervisor has to also release the reports to the insurance companies and things like that. And then the captain that was in there just got transferred out, but currently he's detailed out, so he's maintaining his certification currently. Well, we have to continue to evaluate whether that will occur, but that's the 7 that we're talking about.
So are they in your budget or the police budget?
They're in our budget.
Your budget?
They are in our
all
budget.
7?
Yep.
Okay. And my last question, I was surprised to see The small amount of money for the, for your dogs. 8,000, I think it was.
So we budget that yearly. There was a state mandate that came out last year that, and it's rightfully so. So we use these canines when they're in their prime. We put these canines through a lot. When we retire them, the handler typically takes them, but that's when they have health issues. The state actually came out and mandated that a retired canine that is transferred to somebody, that the city still has to maintain the health care for that up to $2,500 a year for a maximum of $10,000. Now, we've always looked at that. So what you'll see in our budget, there is a little increase in there, but we get public donations for it. But because of financing laws and to make finance happy, because we want to make sure every penny's there, it used to be a certain account, and it was supposed to be used within that time period of the year. So we're going to continue to bring that money in. That'll just go back into the general fund as we do it. We're not going to stop anything we're doing, but we had $6,000 that were already brought in. So after talking about it and looking at the mandate, we put it in our budget yearly, and if the money's not used, it'll just get turned back in. But we're going to continue to bring in donations to offset that anyway. But currently, we have enough in our budgets to maintain them. The canines themselves, I know when the mayor gave his state of the city, talked about how we had one canine retire and brought another one on board. Well, that canine was purchased by Chesapeake Canine Association, so they paid for the funding for that dog. So that didn't cost us anything there. Most of our dogs, I think the city's maybe bought one of our canines. All the other canines have been donated through public donations. And it's not, our handlers, they're not just canine officers. They just wait for a canine call. The canine is sort of like the jaws of life. It's sort of like that $90,000 monitor we talked about. That's just another tool in the toolbox. Mm-hmm. That's just a tool that they use, but that's not, they don't just sit around and work their dog all day long. That's just a small part of what they do.
And they are cross-trained.
No, our dogs are not. Our dogs are single-purpose explosives only.
Oh, okay.
So they go out and they'll help the police on a scene where they're looking for a gun, but they don't do drugs. Our dogs don't. The police department have dogs that are drug dogs, but we have the explosive canines in the city.
I remember Deputy Spriggs bringing his beast in here, but I thought you were hiding drugs.
No, he had explosives in the room. He just didn't want to tell you.
But my last question, this isn't a question, this is a statement really. We are giving by state regs, our canines post-employment benefits.
We are now.
Okay.
Us and every other jurisdiction in
the state of Maryland.
Okay.
And they even changed it this year because they left some search and rescue dogs out in the fire service in the original bill. The state legislator went back this year and corrected that, and they're covering, while the arson dogs are police canines, some of the search and rescue dogs weren't, and they are now covered under that same bill.
Thank you, gentlemen. I appreciate everything you do.
So it is the right thing to do. I mean, we should be doing it, but it is also one of those unfunded mandates that we talk about all the time that get thrown upon us. Now, we have always worried about that. That's why you'll see it right on our webpage that we take those donations and Chesapeake Canine for us in APD and actually the Capitol Police up here on State Circle, they are a tremendous asset, and they love taking care of the community by helping with the canines. Mm-hmm. They're all about these canines. Yep.
Well, I appreciate what you do, so
thanks.
Thank you.
I hope the public is listening for a donation possibility there. What a great way to donate. Alderwoman O'Neill.
I will say this, most of my questions have been answered, but I do appreciate all of the information. And I'm going to say, as the first time going through this process, I'm glad I started with you guys because it was very easy to follow along, and I appreciate that. And I know that you made reference earlier, Chief O'Malley, that yes, in fact, you did thoroughly investigate an issue that I thought was going on, and I appreciate that. And I was able to share that with further public members who are also concerned about the same thing. So I do appreciate the link that you went to look into what I thought was an issue that ended up not being an issue. It was a lot of confusion and
So
on our parts.
we do find a lot, and we'll tell you, if we pull up on a medical scene and we have to start providing care to somebody and we call, and it seems like forever for help to get to us. So we're used to getting that concern. Well, we see it with fires too, where they say it took you 20 minutes to get there. No, we had water on the fire well before that, but that's at 10%. We're meeting the 90% goal, and we want to know if there's areas of improvement, and that's part of our improvement program. So we actually appreciate you bringing that to us, and it bothers us when we hear that it felt like it took longer. So we want to assure that it didn't, and if it did, what do we have to do to correct that?
Yes, thank you very much.
Sure.
To offset that, a little personal anecdote, when I had to call you for my accident, I swear I don't think I even hung up the phone and I heard the sirens coming from 2 stations. So that was pretty cool. Anyways, I have Alderman Savage's questions. I did my best to try to take some crypt notes, so I apologize if you answer them. But let's try to go through. There's 7 of them here, and we'll try to get through them. And then, of course, Alderman Gay and Alderwoman Pendle Charles. The first one was explaining the jump in salaries, and I understand then that this was due to the pensions and cost of living, if that's correct, if that's a fair statement.
We believe that is the majority of the cost, and then that first 7 years when we had brought on the newer people, that jump is in there.
There's no COLA in there, there's step increases.
Steps.
Step increases. Thanks, Katie.
But it covered last year's COLA. 3% went up to show the difference.
Yeah.
Yeah.
Oh, I just want to be polite. We have Katie Connolly here. She is our assistant. What is your formal title?
Senior accountant, budget.
Budget analyst. Yeah, thank you so much for your time.
We're glad she's here too. She is the budget specialist. She helps us out.
And then the fire station alerting system costing $225,000. You explained that it was necessary, that your properties need the protection as well as other commercial properties. Is that a fair?
That is a fair statement. We're hoping that it's not going to cost $75,000 per station, but that's the number that came up with. So we're going to do it for the least amount as possible, but we don't plan on it being more than that. Just to go back into the number one question, so that the one you just asked about was an enhancement that was in there. That's the one-time cost. In the salaries and benefits was an enhancement was for that quality assurance officer. So that is part of that increase also for the number one question.
Right, and that, again, as you said, ties into your performance.
Yes, ma'am.
This gets a little bit granular, but let's see if we can do it. Can you break down the run statistics further? How many engine calls go out to only fire calls? How many go out to EMS medic calls? You did say 70 to 80%, and I think you actually have an actual percentage go out for EMS. Is that, he references slides 9 through 12, but I don't know if those marry up or not.
Depends on how deep down into the details you would like to go.
Those, I think maybe we can provide those under separate cover, perhaps, because it's, can you break down the run statistics? Basically, that's a pretty, a granular question that probably best in writing. And go ahead.
I'm sorry. There was a part of that one question where he wanted us to explain what equipment goes to what types of calls. And so I would just give you an example, for instance, for the Forest Drive Fire Station. The fire engine out of that station ran over 2,700 calls last year. The paramedic unit out of that station ran just under 2,700 calls per year. Mm-hmm. And that's just out of that one station. And then if you add, I should go back and correct that. There are times where there's another fire engine that would run out of that station. For instance, the frontline engine is getting maintenance done, and so they'll just run the second engine out of there, which just has a different number. So if you add those two together, the engine out of that station ran probably over 3,100 calls last year. So then if you ask for a breakdown of what type of equipment goes on what type of call, and I believe that was his question, any serious call, priority 1 or priority 2 call, and when I say that, I'm saying chest pains or trouble breathing or a fall, you're going to receive an engine company, which is 3 people, and a medic unit, which is 2 people. And the reason we do that is because it may take that amount of people to move a person, depending on their weight, depending on their location, whether they're on the 2nd floor of an apartment, the 3rd floor of an apartment, whether they're down an embankment, the level of treatment that they're going to receive. Lots of times we have paramedics that are on the fire engines as well. And so you may get a call for a high priority patient that's going to require 2 paramedics to treat them. One of the paramedics is going to be on the medic unit. The second paramedic may be actually on the fire engine. And so that paramedic will actually go on the medic unit and then ride to the hospital with that patient as well. So it's kind of a trick question when you ask what equipment goes to what type of call. And it's not uncommon for instance, units from this station to be on a call, let's say, off of South Cherry Grove Avenue, and then there'll be another call somewhere else off of Forest Drive. Well, then you're going to need crews to come from a different station further away, and that may require, a ladder truck if that's the next closest piece of equipment, which will have 3 people on it, and they'll all 3 have medical certifications, and it may pull the medic unit from the Bay Ridge station. It just depends on what's going on in the city, the time of day, the location. All of our vehicles have what are called automatic vehicle locators mounted on them. And so the system, the computer-aided dispatch system that sends them on calls, searches for the closest piece of equipment, regardless of what it is, and they're going to send that piece of equipment to the scene of that call if it's available.
And that's internal, that's your system.
Yes, sir.
So,
That's pretty cool.
so when I told you we have as much information as you want, I mean, we can provide it, but basically 9,392 calls were EMS related last year in the city of that we responded to. 3,004 fire calls, and then 26 hazmat, 182 rescues, and 55 service calls, which would all fall under the fire side because the fire engines, the fire equipment would be handling those. So about 4,000 calls for service or fire related, 9,000 are EMS related. So 2/3 of what we do, the 70% is EMS. Like Chief Spriggs talked about, if we get a cardiac arrest call, we need a minimum of 6 people on that call. Protocols have changed. If somebody goes into cardiac arrest right now and we arrive on the scene, we're going to work that person on the scene for 30 minutes at the scene. So that's 30 minutes of high compression CPR. That's 30 minutes of drug medication. That's airway management. So you need those people. I know that you've probably heard me tell you this multiple times before, but nobody ever seems to get injured on the first floor. So you typically have to be carried out from the 2nd floor. And society, I don't want to say is larger than it was back in the 50s, but statistics show that moving a patient around, and we go back to our number 1 goal about firefighter safety. We want to prevent back injuries. We want to prevent injuries and getting somebody down narrow stairs, even though we buy the best equipment out there. And I mean, when Chief Spriggs and I used to carry people down the stairs, we were carrying them down the stairs. Now we have stair chairs that actually have tracks on them that help you ride down the stairs, so we're not actually carrying people. But even so, if you have 2 people there, you have to have 1 person behind them. We only have 2 people in the medic units. So his question about do fire engines go on call, EMS calls, it is typically as a first responder, but any priority 2 or 1 call, you're going to get a fire engine or suppression piece on. So any fire engine that's out there, it's still, because of what we do is 70%, you would think mainly 70% of their calls are there. I know there was a question about whether or not everybody was a medical provider. Everybody within our department has a minimum training of emergency medical technician.
Right.
Or higher.
Right.
And the ALS providers can give advanced drugs, do advanced airways, can actually cardiovert people. stuff like that. But our EMTs can give epinephrine and some other drugs out there, help with glucose. They can do things at that level also. But it's also, we talked about every time a medic goes on a call and takes somebody to the hospital, they're out of service for at least an hour. Well, that means when they're out of service and the next call comes in, well, the fire engine's the closest because we want to get an EMS professional on the scene. So the fire engine will go, and then we'll bring a medic unit from another station. I get it all the time about, is it cost effective to send this fire engine? It's only getting so many gallons of diesel fuel to the mile to the scene. For us, because of our staffing levels and the number of calls we run, we still feel it's the most efficient way to do it because they're available for the next call. I don't know if you remember last year where I talked about if we'd have sent the crew from the Forest Drive station out in the pickup truck to the medical call. As soon as they cleared that medical call, we had a structure fire off of Newtown Drive where 3 kids were pulled out of trapped on the second floor. If they were in a pickup truck, they wouldn't have had their hoses, their water, their SCBA to go in and make that save. So for us to be available for that next call, sending that fire engine. I know it's really tough when they see ladder trucks on medical calls. That's the one where you got the person in the front and the back, $1 million piece of equipment. Out of their calls, they maybe run about 400. The one truck maybe runs 400 EMS calls, but they also have rescue equipment on it. So they're going to auto accidents, they're going to calls like that. But the truck crew at the Eastport station, they cross staff and they take our high peak medic units. So if our medic units are on a call, they're not going to take the ladder truck to the EMS call. They're going to get off the ladder truck and take that other medic unit. So we always look at ways to improve it, to being cost effective. We know that fuel's up, but we still feel that it's still the best bang for our buck for as busy as they are and to be able to handle the next call. Okay. And our surrounding jurisdictions are doing the same thing.
I think under separate cover, if you could email and copy us on the stats that you just mentioned, and we'll get those, maybe send it to Kia and then she can distribute. That would be good. And I think what you've just explained is Alderman Savage's concern about over providing versus efficiency. It seems like you've done a balance of assuming the worst case, so to speak, balance with efficiencies.
Yeah, that's the only way for us to get multiple people on the scene. I know part of that question was how many fire suppression pieces we have compared to that. So I can give you that too if you want it. Okay. So the city of Annapolis owns 7 medic units. So we operate 4 medic units independently staffed every day. That means those 4 are always staffed. The 5th is our high peak unit, which is cross-staffed by the ladder truck at the Eastport station. So we have 5 units in service every day. That leaves us 2 reserve units. One of which is our bariatric unit. So anytime you have a patient over 250 or 300 pounds, they typically need the bariatric unit to do that. It's got a larger stretcher. It's got a ramp on it. It's built for that, so they have to go get that unit. But that is one of our reserves. So it's set up as a bariatric unit, but if we have a unit that's out of service, then we'll put the reserve in service for that. We talked earlier about how it's hard getting parts and how there's an increase in parts. Well, what we find is we send a vehicle out to a dealer for a recall or for some maintenance that fleet maintenance can't handle. It's out of service for quite a long time. We have one unit now that's out because of some accident damage that'll be out for multiple months. So that reserve will be running that the whole time. So we own 7 medic units, 5 in service every day. We own 5 fire engines, 3 in service every day. You have to have those spares because when they go down, we got to be able to do it.
That's a pandemic related issue as far as supply chain.
So if it's not, it's blamed on it. I can tell you that. So we have 2 ladder trucks, one at the Taylor Avenue station, one at the Eastport station. Anytime you have a structure fire, you need 2 truck companies. And we have 1 rescue squad, which is our special services unit, which has all the rescue equipment for hazmat, for car extrication stuff, auto extrication, high rise. So that's the bulk of our large apparatus. So 7 medic units and then 8 large pieces of equipment. Everything else is small utility type vehicles or less.
Okay. And then he asked about the Fire and Explosive Service Unit. Are these inspections or calls?
So,
I would say they're calls, aren't
yeah,
they?
you can explain that if you want.
So to answer his question about the 338 calls for the Fire and Explosive Services Unit, those are calls for service, not inspections.
Okay.
The inspections were listed different in another location under fire building permits, use and occupancy, other inspections. It looks like total. Oh my gosh!
Okay.
Just doing quick math in my head, maybe 2,400 inspections and 700 re-inspections, but those are not done by the Fire and Explosive Services Unit. Those are done department-wide. So our code enforcement division has, as Chief Morales mentioned, 2 civilian inspectors, as well as a captain and a lieutenant. So they all conduct inspections. The captain runs that, obviously. But the firefighters and paramedics assigned to the stations also conduct inspections as a part of their daily duties. And so when they're not running calls and when they're not training, they'll go out and they'll do some life safety inspections just to verify that exits aren't blocked, that the buildings have the appropriate lighting, that the discharge ways are not blocked, and things of that nature. So they'll do numerous inspections, and each station is assigned a number of inspections per month that they have to complete, and that's on top of their training, and that's on top of their duties at their station, the calls for service that they run, waiting at the hospital. And those medics may clear the hospital after being there for an hour or two, and they have to go and do a building inspection. That's just a part of their job.
So the Fire and Explosive Services Unit goes into Alderwoman Finlayson's question about the trained law enforcement people. That's those 5 full-time investigators. That's that unit. That unit of 5 handled 300 and some calls for service.
And also your answer to Alderwoman Finlayson's on cross-training is helpful in answering some of these questions. Last but not least, I think I'm going to just refer to the presentation to Alderman Savage on the summary of budget enhancements. You did provide those. Alderwoman Finlayson asked if they were all included, and you said yes, so there's no others. And then your metrics were, I thought, explained in one of your slides, if I'm not mistaken. Well, metrics are basically, I assume he's asking about performance measures, so, okay.
Yeah,
Okay.
we have the performance measures for this year. We provide them for
Okay.
the city manager. We have those stats if you need those, but
Okay.
basically it falls back into that one side, what's worked and what hasn't. You saw what we're doing well with, because that's done through our performance measures, and the ones we haven't met were the ALS providers and the stuff we talked about.
So far, just as the racial proportions in your staff, and then the data from Alderman Savage. My colleagues don't know this yet, but I think we're going to be addressing racial inequities in our Finance Committee report, and so it's nice to have all that information. So,
Madam Chair, may I ask another question?
Of course you can.
Just to follow up, you're going to give us your stats, your calls for service for the year.
Yes, ma'am.
Is there a way to delineate how many of those calls are out of city?
We can give you the number of calls that we responded to mutual aid. So for our calls, it's basically 2/3 in the city, 1/3 out, which, as you all know, we share the Annapolis Next station. So when I tell everybody we run 3.5 fire stations, they're always like, how do you get half a fire station? We share the Annapolis Neck Fire Station, which is a county-owned station. They run an engine out of there. It's a pumper tanker, because the Annapolis Neck Peninsula doesn't have fire hydrants. So they run 3 people out of there. They also run a dive team out of there, which we're members of the dive team. That's one of the specialties we do. But we run the medic unit and the EMS supervisor out of there. And what you'll find is, while we're talking about 1/3 of our calls are in the county, I can tell you that station down there, 2/3 of the county engine company calls they run are in the city of Annapolis. So
Interesting.
we share resources, and I know it always comes up about merging and other things. Well, if it happens, resources are going to get lost, because we share resources on a daily basis with Anne Arundel County, and they're called Naval District Washington Annapolis Support Services Fire Department, but the Naval Academy Fire Department. And it used to be that we provided more services to the Naval Academy because they didn't have a paramedic unit. So over the years, we were running in the academy way more than they run out. Well, that has since changed because they put a medic unit in there to run their medic calls. So they replaced their ambulance with a medic unit. So typically, the Naval Academy runs more calls in the city of Annapolis than the city of Annapolis runs in the Naval Academy. And then obviously we go to Prince George's County, not Prince George's, Queen Anne's County to assist them. Well, not regularly, but it does occur, especially when it comes to marine assets. But we work with our mutual aid partners, and it's automatic. It's not like the police department where sometimes because of the laws that are out there, the police it's a little different. But for the fire service, it's interactive and every day, and it's automatic. Chief Spriggs talked about the automatic vehicle locators. If the Naval Academy is riding through the city and somebody's in cardiac arrest, that Naval Academy fire engine that's a minute away, they're going to be the ones that go there. So that doesn't happen throughout the United States in all places, but here it's automatic. It's automatic aid. It's really not mutual aid. It's automatic aid. But yeah, to lose any of those resources, because we get it, because they run, the Naval Academy has 2 stations. They run what they call Quint. So that's a fire apparatus that doesn't know what it wants to be. So it carries water hoses and a ladder on it, but it's only a 75-foot ladder. We have 6-story buildings. That's why we have 100-foot aerials. But everybody, not everybody, but we get that question. Well, the Naval Academy has a truck that's got a ladder on it. But when we run a structure fire, it's 5 pumpers, 2 aerial ladders, a rescue. One of Alderman Savage's questions was whether we send EMS units to fire calls. We do. It's all about safety. So a medic unit, a safety officer, and a battalion chief. So we send 25 to 30 people on a structure fire, and that's needed. And that's basically set up through the NFPA standards. So it's not like any resources. I mean, we're bringing those in, and we don't have enough resources in the city of Annapolis to handle a single structure fire by ourselves because we don't have that much equipment. Or we may have the equipment, but we don't have staffing on all that equipment to do it. So, but it works very well. We work well with our partners. If we have any concerns, we bring that up with them, but it works great.
Chief, that's why I asked the question, because I want everybody to understand the relationships that we have with the county, with the Naval Academy. And isn't there another group, not within, I guess that's the police. But anyway, we have a reciprocal relationship with all of these agencies. So it's one for all and all for one. So any information you could share about that would be great.
Sure.
Thank you.
That's a great question. And let me just ask, because you brought up is it a 6-floor limit on your ladder truck? Like what if there was a fire? This might demonstrate that cooperation. What if there was a fire at I don't know what it's called now, but Watergate Apartments in Eastport? How would you service that?
So we can get to the 6th floor. There's 6th floor buildings there. You go out to Pearl Town Center. Anne Arundel County doesn't have anything taller than that. We're only getting to about the 6th floor.
Right.
So with buildings like that, we're hoping that the codes they're up to code, that ventilation systems, but we have operational procedures on, we'll go get them. If somebody's on the 20th floor, we're going to go get them. They're not coming down a ladder.
Yeah.
We're going to go in and get them, but we actually have procedures, and this multi-jurisdictional. We meet with the county and the Naval Academy, basically the county. Our OPMs are very similar to theirs. They are the same. And, we identify an attack stairwell and a rescue stairwell. They're just plans that we have that we train on how we would go get somebody above that. But for us in the city, we have Americana Drive. We have 701 Glenwood Street. We have 29 West Washington. And we have Park Place. It's 5 stories, or in Severn Avenue. We had that 2-alarm fire in Severn Avenue. So having those 100-foot aerials is desperately needed.
And using that argument, this is just a really valid point because it comes up every year. Is that if you combine services, for example, Anne Arundel County, where do you think they'd be more focused on Parole Center and some of those high rises, or a fire in a dwelling on on Washington Street. So anyways, that's being more editorial. But anyways, questions for Mike? Go ahead.
I'm sorry, I didn't mean to cut you off, and I'm working on that because I have a tendency of not letting people finish.
No, that's
Our concern,
That's
our major
great.
concern is the city of Annapolis. We are worried about the city. We help our counterparts on a daily basis. We need them, they need us, but that is our concern. It is my belief that if we were to really look at some sort of merger, the county has to look at the overall county. The county's ISO rating is a lot different than ours because they have non-hydrant areas. You wouldn't be able to cut the city's ISO rating out from that. There's a lot to it, but the county has other needs also that they probably want to move some resources around to be able to handle the overall needs because of their goal is the entire county. Our goal is focused on the city of Annapolis. Part of that is, they ask all the time about the bomb squad, why we have it. Well, we provide those services to Anne Arundel County because both of us aren't going to have it. It's regulated through the FBI, but it's because of the uniqueness of the city. They always compare the city to other jurisdictions, but I don't know how many other cities our size can tell you they're the state capital. They have the United States Naval Academy. They have St. John's College. Because we're the state capital, people want to come here, and we have a beautiful city. So we have 100,000 people. We may only have the 40,000 residents. There's 100,000 people in the city of Annapolis every single day. So it's hard to compare us to those other jurisdictions like that because they're not as unique as us. But we share the resources. We have them, and we're here to help everybody in public safety. But our focus is the city, and everything we ask for is what we believe the city of Annapolis needs and our residents.
Questions, Alderman Gay?
Yeah, thank you. That's all right. Thank you all again so very much for what you do for our city. It's incredible, and each time I hear you, I learn something new. But one of my questions or comments was, when you have calls and you have multiple stations, but still, sometimes you have to respond to Anne Arundel County calls as well. And we are more vulnerable here in the city by being the state capital, the county seat, and all of that. So that was a question/comment, but thank you for providing us with that extra information. I have a couple of questions, and if I go over my 5 minutes, then we can come back to that as well. As far as the mobile integrative health program, is IT involved in any of that? I was going to ask, especially since Mr. Packman was here. As far as I figured I'd utilize him since he's here. As far as funding or anything that you need IT's help with, funding-wise or whatever. That's my first question. My second question, you alluded to some of your contract services that are based on the Police Accountability Act. And the other question was just a little more information about this further accreditation beyond Class 1. So those are my 3-4/question comments. So the first one.
So the first one is we currently have no IT needs, but that every time we need something from IT, we need to upgrade their computers on the medic units, or that Brian and his staff are there to help us. And when we sometimes run into funding challenges, we make it work between both our budgets. So yeah, they're readily available to assist us. Number 2, on the police accountability.
Will you need them additionally for this mobile integrative health program?
Not currently.
Okay.
Currently, that program is going to go on for years, but we need you to be aware of it. We don't know what's going to work and not work, so we're going to continue to grow that program, and what works we'll continue with. What doesn't, we'll scrap that and move on. For the police accountability, the only thing we're picking up currently is the psychological evaluations for our people. All the other training involved in the police accountability training is going to be done through the police department. We are included with that. We train with them. We do our in-service training. The only cost currently to our department is for the the psychologicals, because it's for our people that are employed by us.
Is that the 7 persons you were talking about?
That would be the 7. And
Okay.
that's just an increase to our current physical budget for the different evaluation to be done.
Okay. And the third question was about this additional accreditation beyond Class 1.
So back in the 80s or 90s, we were accredited through the Commission of Fire Accreditation. It's very similar to CALIA. It's just, it takes money to do. Actually, when we went and increased our ISO rating, Chief Stokes, myself, and Chief Spriggs sat down and talked about it to see what was our best bang for our buck. We felt that getting the ISO certification helped our residents more. So we went and improved that first. And then we were just going to go around and eventually look to go back to that. And that's a lot of just going in, looking at your OPMs, your procedures. It's very similar to CALIA, but they have requirements. So there's certain things you would have to do, and it costs money. So we're going to look at that. It's not a high priority for us. It's one of our long-term goals. Our current priorities is to maintain our ISO 1 class certification and to continue to provide the best services we can. But that's just a long-term goal.
Are you looking at that possibly for funding for fiscal year 24? Or
We're not sure which year out yet. We're just really looking into it now.
does that affect insurance rates as well?
It will not.
Okay.
It's just an additional to let everybody know how good of a agency that we have.
Okay. We're proud of our Class 1, and we're hopeful that maybe the county can get to that point, but that's a great benefit that we have here in the city to be a Class 1. I think that's extremely important.
So if I could go just real quick to your original statement about knowing that if we have an incident and we have different fire needs or fire losses that we worry about. But when we have multiple incidents going on, or all our crews are either on a call in the city or even if they're on a call in the county, at that time, we have procedures. Chief Spriggs and I are on it. We get transfer crews in here. We sometimes move some of our day work, our training division staff, put them on a fire engine or something. We'll ride it if we have to, but we'll have people transfer in from Queen Anne's County or from Anne Arundel to fill our stations while we're out. So we always look at the needs, and we always want to make sure there's somebody available in the city. So I just wanted to let you know that.
Okay, great. Thank you all so much. Alderman Gay.
Thank you. I appreciate it very much. I have a couple questions. My first comment, though, is in reference to the dogs receiving health care benefits and stuff. I was watching Jimmy Kimmel a couple nights ago, actually, and Viola Davis was on, and she was talking about, they just had bought a puppy or whatever, and the dog had got sick, and she took him to the vet, and they wanted $5,000. And what she said is what my thought is when you say dog health care. Back in my day, the dogs ate grass to fix their health issues. We didn't pay $5,000 for them to go get, special checkups. And so that completely blows my mind that the dogs have health care and some people don't. That's crazy. My first question is as it relates to the MES fees collected, $1,708,478. Does that go to the general fund and then back to the fire department? How is that money distributed?
So I will defer to the finance director, but it's my understanding that as we do our budget, that those things are considered, but she can answer the question about the money.
All of the ambulance fees are one of the revenue sources within the general fund, supporting all general fund activities. We don't have any of it earmarked for fire, although it is great when we can get more reimbursement for the services we're providing. So that is part of the reimbursement for their services.
A little further explanation would be great for me. I'm confused. Why wouldn't it go back to fire? Or what's just there a longer
in the
process to
general
do that?
fund, departments do not have their own revenue to operate. All of the revenues are pooled together for the general operations of the city. So finance generates some revenues by billing out rentals. That doesn't go to our department for our expenses. Theoretically, I mean, in very general sense, we're getting reimbursement for the services they're performing, so it does benefit them, but it benefits the city in general as well. I don't know how much, if you look at all the revenues that we have, some of them are generated by planning and zoning.
But
They charge for a permit because they've got a permit officer going out. We don't allocate that to planning and zoning specifically, but it does help to reimburse the city for the services that they're performing.
And this is just breaking it down, and then I have a second question. So essentially what's happening is that revenue is being poured into the general funds, and then obviously we go through this budget process and the departments are able to pick it, propose what they'd like to see, and obviously we vote on that. My question is, would it be easier, and maybe in your finance experience, you worked with the county, and I'm assuming you've had jobs before that, have there been scenarios where a department would produce revenue and the revenue would go directly back to the department?
So, well, it would be a type of fund, not necessarily an enterprise fund. If we had a special revenue source that we wanted to target for a particular purpose, we would separate it off into its own fund and spend it accordingly. That's what we do with the grant funds as well. That's what we do with the seizure funds through the police department. And for any department that was where we wanted to designate a specific use for a revenue, we would account for it separately.
So in order for us, and the reason I'm asking is asking this question, people get on me all the time because I say asking instead of asking. So I correct myself with that. The reason I'm asking that question is they have an operating budget of almost, the operating budget is less than what they collect in the MES fees.
So most of their budget is covered by property taxes and income taxes. Other general revenues that we get
that are in
citywide.
Okay, so I mean, and it works, so the system works, but I'd like to give that just back to them. How could we do that? I mean, does it have to be proposed in an amendment, or?
Okay, if we give that, when you say we give that back to them, do you mean allow them to use that? They're spending 22 million and they're generating 3 million now. They make 3 million in revenue. They spend 22 million.
Okay. So are you mixing?
They get more. They spend far more than they earn.
Yeah, but for operational expenses and some of the things that they have in-house, would it not make sense to, instead of them taking 200,000 out of the one-time fund or 60,000 for the gym, to use those funds?
I think the point that's really important, and I wish we could show the general fund and what.
I've seen the pie chart.
Right, but all of that goes into a bucket of money, which is supported.
Okay, I'll move on to my next question then.
But they don't have their own revenue source.
It's fine. I'll move on to, it was just a quick question.
I understand, and we have the Medicaid revenue that they found a company that's going to help us get more Medicaid reimbursement. That's wonderful. They have significantly increased what they're bringing in for 23 and 22 and 23. So when we do have departments that do that, we like to consider their enhancement requests. And I think most, if not all of their enhancement requests have been honored this year.
Okay, my next question, I think someone touched on briefly, was as it relates to the explanation on goal number 6 with the telehealth, which I think is a great initiative. Could you just explain a tiny bit more on that as well?
So that's part of the optional protocol that we're trying. That is very new. We had to go through MIMS, which is the certification agency, to be able to do that. And then we had to make partnerships with a hospital. There's some requirements with it. They call it ET3. It's basically emergency, treat, and transport, but it's part of that program. And it's the ability just to have the doc come up on the iPad and talk to the person that way. We have not had many people that have been willing to do that yet. And I don't know if you were here when I was trying to explain it. It's very new. It's sort of like us transporting somebody to an alternative care facility, which is MedStar's out there across from the mall. So this is a new push in emergency medical services that it's It's brand new, so we'll see how it works. But it's going to give us the ability with those lower acuity calls that somebody maybe not need to go to the hospital. They can actually not only talk to our medics, but talk to a doctor face to face, and they can make that decision then. Or no, so
I think
it's something
that's-
that we're going to be looking at and trying to expand upon.
Yeah, I think it's great, and so you're going to them, or they can potentially even come to the station and have
So
this.
it would be a call for service, whether it's a walk into the station or we go to a
it's-
structure or somebody's house.
A physician at the medical center or at an off,
So
or
we're-
like at a what is it, nighttime?
We're still working through it. That was part of, because MedStar's, the alternative care facility, wasn't open 24 hours a day, we couldn't have that agreement with them. So we were working with Anne Arundel Medical Center and the doctor's partnership there to have somebody available for us to do a consult with them. And that's what we're working through.
Awesome, that's great. And I think that should be advertised as well, particularly for people in low-income situations, who rely heavily on, Medicaid and Medicare. They're still getting billed to the tune of $1.7 million in EMS fees. And if that could be reduced, obviously it hurts the general fund. But I just think it's helpful for them instead of being back and forth to the emergency centers.
So I'm not sure that will have a major impact on our EMS transporting. Because there's actually a way in there. It's sort of like a doctor's visit. There's still
So they
a
still
cost
can charge.
associated with that. But when it comes to Medicare and Medicaid, they only pay, Medicare and Medicaid only pay $100. I think it's going up to $120 per call. But now we've been successful and we can go back yearly and actually show them the cost that we have and come up with some additional fees. And that's where the additional 1.3 is coming in. And if I could just go back to your first question, when you were talking to Jody, we're happy with our enhancements and what's in the budget. We view the EMS billing money as, yes, we have a $22 million budget. We're trying to offset it with EMS fees. Whether that goes to the general fund or not, it's still part of what we're doing. We just hope you take that in consideration, that we're bringing it back. But with the enhancements that are in there, it'll meet our operational goals for the year.
Awesome. My next question, the Quality Assurance Improvement Officer, $150,000, and included benefits, etc. I've only been here in 3 budget cycles, but each budget cycle that I've been here, fire has been one of the only departments to consistently add more staff. Or I believe I think last year they added one I was here, maybe one the year before, if I'm not mistaken, or maybe it was proposed.
So we have not proposed any additions. We did get the grant where we added additional staff, but if you remember, that was part of when the city had to do some furloughs and layoffs, and we lost several positions back then. It was supposed to be temporary. And then we got a federal grant to bring those positions back on board. So what you were seeing over those years was getting up to par where we had to start paying for them again. We got some federal monies to do it. Last year, we switched the position around. We got the fire protection engineer, but we used existing personnel. We changed the firefighter spot for that. So we haven't enhanced any of them. We are asking.
Switch that I was confused. Yeah, okay.
Yeah, we are asking for a position this year, but in general, you are right. We added positions that we lost to get back to where we had planned on being and where we were prior. Yeah.
And so how do you anticipate the additional staff member?
So this is a position that we discussed a little bit in length before you got here. We have EMS is 70 to 80% of what we do. We know that all our people wear multiple hats, and sometimes when that occurs, because we put so much on them, certain things fall off the plate or start to lax. Our quality improvement program and quality assurance program, which is mandated under the state, under medical and health laws, we found after we did an external review, we found some concerns with that review process that need to be addressed so that we can look at trends. We can look to see why, if our cardiac survival rate is down, and the one person in EMS just can't do that because of this telehealth, because of the COVID, because of everything. There's no way for that person to do it. And to find that our system was not the best in the state where we should be, is sometimes hard for us. It's hard for us to hear. We always know you can improve, but we found some areas that were lacking, and it's sort of being mandated by the state that we have to, well, we went to them and told them, this is how we're going to fix this. And basically, we have to put a supervisor in there to oversee the program. But we run 9,000 EMS calls a year. Every report has to be reviewed. We have to make sure there's no protocol variance, make sure that there's no medication errors, that type of stuff. If it is, it's got to be reported to the state within so many days. And we found a couple laxes that we could be doing better. And to do that, we know because of everything that's being thrown on us with EMS care and healthcare that we need this additional person to do it. And basically what it does is it promotes a supervisor from within our department and hires a firefighter. But the position is that lieutenant's position going in EMS. But it's still a provider that can provide training, can go out on calls when we have the high priority calls.
Okay.
So that person, but they just work a day work shift.
We're going to try to round a lot. Brian's been sitting through, so I know that's fine. One last question?
Well, we'll maybe email you, I don't know, and get additional answers.
Okay.
So yeah, we're fine. And if your questions are emailed, we'll make sure that the chair gets every question that's out there. We have some from Alderman Savage that we're responding to. So
Yeah.
you know us, we have nothing to hide.
Right.
There's not any fluff, but we will show you and give you the statistic you need and show you where we are and what we're thinking.
Yeah, Brian, I'm allowing, I think it's probably going to be about 45 minutes or so, plus we have some legislation. But we could go on and on and on, you know, and I did want the public to see what part of the entire general fund you are and what their property taxes are paying for, which is the most important thing that residents are interested in. And Alderwoman Pendle Charles, if you have any other questions, you can email them, or were you done?
I think I'm done. Thank you so much.
Thank you for your cooperation. So, oh, wait, we have to confer. Hold on. We wanted to make this as painless as possible, so we have a gift, but it comes with a disclaimer. The disclaimer is that this does not constitute acceptance of your budget, contingent on my colleague's review of the same. So, Alderwoman O'Neill, I think we need two of them. Do the honors. It's a numbers ball. You can pass them along in your department and have fun, and so just these little
We will
toys.
definitely pass them along. We thank you.
Yeah.
And we appreciate the support. So,
Isn't that a
but
first?
Isn't that the cutest thing?
This is, yeah, we'll actually enjoy
Yeah.
these, tell you the truth.
Dollar store comes in handy. So we also have another gift if you really fail, but we're not going to be judgmental, as my colleague reminded me, but I can show you what it is. No.
Have some candy.
Yeah, have some candy as well. So thank you very much, as always. Thank you. He was asked, but he wanted to sit through your presentation. Right, Brian? Well, it wasn't it was, being that you both had the best presentations last year, we wanted you to kind of keep the bar, you know, raise the bar like you did last year, so fire and MIT.
Thank you, Jennifer.
So, yeah, Brian, what we'll ask you is just go through your presentation. If we have, and our questions will be afterwards.
Sounds great. Steve, okay. Management Information Technology Division is dedicated to delivering high-quality, technology-based services in the most cost-effective manner while providing excellent customer service to all city staff. Municipalities are increasingly a target of cybercrimes, including ransomware.
Mr. Paquin, would you turn your mic on, please?
Thanks. That's probably
You're not an IT person, are you?
it's probably what my computer was dinging about. They're watching me across the street, telling me my mic's not on.
Did you add that slide? We have your presentation attached to our agenda. Is this going to be?
So yeah, there were some last minute edits. I apologize.
We're flexible, that's fine.
The Google Slides version that's in the working documents directory has all the updates in it.
Cool, and we get it as well, so, yeah, cool.
Okay.
Thank you.
Okay, so do you want me to start over, or was?
No, keep going.
Okay. So municipalities are increasingly a target of cybercrimes, including ransomware. These threats are constantly changing, and MIT requires funding for training, services, and hardware to continue to protect city assets and information. And we look forward to not only continuing to bring you the level of service that you've come to expect, but rolling out new products and improvements in FY23 and beyond. The MIT team is 2 MIT specialists. There are desktop support, break fix, help desk type people. 2 MIT analysts. They're the ones that run our project development. And the MIT admin support analyst is our administrative and also help desk and break fix person. She helps out a lot with that as well. Our GIS team is a coordinator and a technician, and web and social media is run by our webmaster position. So a few highlights from the ongoing fiscal year. We, of course, throughout the pandemic, we worked hard to provide equipment and support for our teleworking employees. A big part of that is providing our virtual desktop solution, that allows our users to work from home in a secure manner. So we were fairly recently able to alter the licensing model that we were using to provide pretty significant month-over-month savings for those workspaces. The 2 very large servers that we're using to be the hub of our virtualization project have been brought online in this fiscal year, and 6 of our individual physical servers have been virtualized into those boxes and the physical server taken offline. So replacement of our desktop and patch management software with a more modern and easy to use for us solution is well underway, and will actually take over for our old solution fully by June. On the GIS side, Sean, our GIS coordinator, served as the staff liaison for the redistricting task force. She provided technical assistance for creating draft ward maps based on the census data and statistical data for each draft. The West-East Express story map talks about trail connections in and around the city of Annapolis, and that's one of several story maps that she has put out so far this year. And the Quick Facts Census 2020 for data from 2020 can illustrate how populations have changed in the last 10 years around the city. On the web side of things, we are now up to 59 from just 11 a year ago, mobile accessible online forms, which in the past, these had just been plain PDFs, which means if you brought it up on your mobile device, you got the little itty bitty teeny tiny text and couldn't really do much with it. These are online forms. These are HTML5 online forms that will adapt to the device that you're using. Allows our constituents to fill out forms and things from any kind of device much easier. Ran multiple marketing campaigns, posting ads on several city web pages and social media outlets in conjunction with the public information officer, with data and stats gathering and analysis. A good example of this is the Annapolis Recycling Project, which got its own dedicated public-facing website. The webmaster, Ina, was able to provide the mayor's office and Public Works with statistics about how their outreach program was going. The intranet site, which is a web-based resource for employees and staff, this was migrated to the same platform that the actual public-facing website runs on. And what that allows us to do is, in the past, you would have to be on the city network to get to that site. We've provided a login process for that, so that site can now be reached from outside of the city network proper. Our analysts, as most people know, are extremely busy folks. The EnerGov, which is our replacement for Trackit, the permitting and licensing software, will go live in May. This has been going on for over a year. It's a huge project. I do want to qualify the statement that it will go live in May. We do not have a go live date yet. It will 100% go live during this fiscal year. But I don't want anybody to get upset if we don't quite make the May timeline. But we're working hard to get that online as quickly as possible. Some internal workings. Tyler Identity is our login process for our Tyler products. That's been recently upgraded, which is a big security improvement. And Tyler Cashiering, which is currently being used by our finance cashiers and will be used by the permitting cashiers once EnerGov does come online. That just got upgraded here recently. The ExecuTime Advanced Scheduler product is scheduled to go live in June, and that should hopefully really reduce the amount of time and effort that goes into the fire department's timekeeping process, which is pretty cumbersome. So goals moving forward for 23 are going to look a lot like the goals for 22. So much of what we do overlaps year to year, much as the fire chief said. Some of these things don't really change on a year-to-year basis, the kind of things that we're trying to provide for the city. Increasing productivity in city agencies by reducing manual or paper-based processes, using automation, continuing to improve public access to the GIS data that we collect and provide, improving efficiency of our data center, reducing our carbon footprint, our electricity and cooling demands. Those projects also improve reliability by increasing redundancy, where we've got things in multiple places where we can try to minimize downtime in the case of a disaster. Developing a plan to make all city technology available to all citizens. This has a lot to do with our ongoing ADA compliance project, which is never ending. But we need to make sure that everything that we're posting online is ADA compliant. And then on the operations side, keeping the city information technology environment safe from ransomware and other data breaches. That's our day-to-day. That's our operational day-to-day, and our number one priority. So our first goal, to increase productivity in city agencies by reducing manual processes. Again, this is going to look a lot like last year's version. Consulting with departments to discuss their needs, and that helps us prioritize which software modules we want to roll out and in which order. And then completing implementation of either modules that we have purchased that were part of our initial software acquisition that have not yet been implemented, or acquiring additional modules that can help eliminate manual processes. The benchmarks, by using agency input, We'll develop and schedule these rollouts for at least 3 city departments or offices, and implement at least 4 Munis modules as identified by the departments or offices. And we'll measure this by the number of departments that get their modules and the number of modules implemented by the city departments. Our second goal is to improve public access to the GIS data. The GIS applications to provide data and information to the public, such as story maps, work with the webmaster and PIO to drive traffic to the publicly available information. And our benchmarks will be to the number of publicly available applications, such as the story maps, and the percentage increase of hits to these layers and other GIS data. And I have number in there twice, but yeah, this will be measured by the number of public-facing applications that we release and the number of website hits to the GIS layers. The objective of goal number 3, to use server virtualization to increase efficiency. The benchmark for this one has been stepped up from last year. Because those servers are now implemented and online, we can kind of accelerate the process of getting these physical servers virtualized. So yeah, we stepped that up to 8, and the measure will be the number of servers we virtualize. The fourth goal, again, has to do with the ADA compliance. We want to make sure that the city websites, documents, and forms are all ADA compliant. And we want to continue to train the individual departmental content providers on how to create pages that are ADA compliant, so that ENA does not have to go back and remediate every single one. So that's an ongoing process as well. Our benchmarks will be 5,000 pages and documents repaired and made compliant, and 100% of the new content posted to the website is ADA compliant. And the performance measures will be the number of pages fixed and the percentage of new content posted to the site that is compliant. The fifth goal, again, to keep the city IT environment safe from ransomware and other data breaches. We want to stay abreast of the changing security landscape, and we do that with training and education for our staff. Improving the password and group policy enforcement for all servers and PCs is achieved through them being on the domain and falling under a strict group policy. Pardon me. And then we will be looking to leverage this new desktop and patch management software to automate patch deployment, so that it's less of a hands-on process, and that's something that'll just take place on its own on a weekly basis or as needed basis. 75 hours of training and education. We came to that number. We've got 3 members of our operations team whose training is ongoing. We'd like to see that each of them achieve at least 25 hours of training throughout the year, and this is formalized online training. 350 more PCs and 12 more servers joined to the domain. 500 desktops and laptops enrolled into the new patch management software. And then the measures are just your quantifiable, just like the other 4. And you don't need me to read those to you. So our long-term goals are 100% unchanged from last year. We want to continue to develop and maintain and this isn't really just PCs, it's really all hardware. Desktop, laptop, PCs, servers, tablets, things of that nature. We want those out at 5-year intervals, staggered appropriately so that we manage costs. We've run into I've been here a long time, and in a couple of points in our history, due to financial restrictions, recessions, things like that, we've gotten behind, and you get so far behind that the need you almost have to replace them all at once, I guess is what I'm trying to say. And we want to maintain this fixed schedule. Develop and implement enterprise asset management software. That's trying to bring yet another portion of city business that is kind of fragmented and somewhat manual under this workflow umbrella that we're developing. Integrate city and county GIS into a shared environment for improved citizen and business experience. And there's been progress made on that. Sean's wonderful and her contacts at the county are wonderful, but that is a long-term goal to actually bring both of those under one umbrella. Making our Annapolis.gov site 100% mobile and ADA compliant, and offering at least 90% of the city government's currently offline services available online. And we'll take a big step forward with the EnerGov project on that, but there's still plenty to do. So that's a long-term goal beyond FY23. So the question was asked, which performance measures were most successfully implemented? Our staff has been really eager to undertake training and certification classes. We have a younger group now. The old grizzled veterans aren't in those positions anymore, and they're really eager to learn. So we well exceeded our 50 hours of training and education. And Ina and our intern Joe have done an incredible job of remediation on the website, and we are now exceeding the national benchmark of 85% compliant. All the pages on the website. At last report from Ina, we are at 86% and climbing. So that has been a big success of our department. And then conversely, which performance measures were least successfully completed? Our domain joining project is falling short of goal. It's a little behind schedule. The implementation of the new desktop support patch management software kind of, if we did the domain rollout, it was kind of putting the cart before the horse a little bit. So we wanted to make sure that was fully fleshed out. But we are pushing forward with getting these PCs joined to the domain. And honestly, by June 30, I believe we will have hit our stated goal. But as of this moment, that's not something that I can tell you that is going to happen with 100% certainty. So we put that guy in there. This is the requisite table. As Chief said, our overall budget number is not tremendously higher than it has in years past. We've been pretty steady with our numbers throughout my time here, and the contractual services number is slightly increased, and the capital outlay budget number, the contractual services number is decreased, and the reason for that is the offloading of the G Suite and chopping that up between the departments. Much in the way that we bill back for the desk phones, we're doing that with the Google accounts. Rather than MIT being responsible for paying the entire bill, we're going to manage that bill and chop it up between the departments, depending on usage. So that's why you're seeing our contractual services go backwards a little ways. And then the cap outlay number, as you can see in 21, pretty consistently, throughout the last 6 or 8 years, we've fallen in that 225 to 250 range. It's kind of gone up and down to based on project needs. 211 yet last year was at the request of the city manager to perhaps put some things off that could wait a year just due to the pandemic and things of that nature. So the reason that number is low, and that number is actually, I think, the lowest that it had been in like the last 8 or 9 years. So we're just basically replenishing funding on that and catching up on projects that were deferred last year. So that's the reason why you see that number up a hair. And this is the way we're planning on spending our capital outlay. Network switch and voice gateway router replacement. A lot of our network infrastructure is getting a little old. And so this has been an ongoing request year over year. The numbers have kind of gone up and down again. This was one of the projects that was kind of kicked down the road last year to get that cap outlay number down. So that's a big number this year, especially because we need to replace the voice gateway routers. And those are the devices, one of the devices that run our internal voice over IP network. So those guys are Cisco. When they say Cisco on it, they're really expensive. Continuing to replace the desk phones is important because a lot of our desk phones, these things are super reliable. Some of the phones that are sitting on desks around here are 12 years old. And they are not going to be, they're not going to be supported for very much longer. So we need to continue to replace them so we don't, again, get stuck with having to replace 300 phones all at once in order to be able to make an upgrade moving forward. 40,000 is a pretty consistent number for us, an ask over the years regarding server hardware replacements, upgrades. A lot of that number comes not necessarily from physical server replacement, especially since we're on this virtualization project, but drive upgrades, storage. Your storage needs continually grow over time. More people are saving things to these servers, databases grow, things of that nature. So storage needs additional memory for servers, things like that, in addition to, through necessity, having to buy the occasional physical server for needs that couldn't be virtualized. And then the miscellaneous equipment replacement, big part of that number, that $8,000 number, is usually monitor replacement. And then we have a printer replacement budget, and a new line item this year is this paper cut print management software. There is a new fleet of copiers coming, and one thing that we have never really done in the past is real accounting when it comes to who's printing what. And this new software will allow us to do that, and as well as try to cut down on some waste. One of the neat things it does is that if you send a print job, it's not going to come out until you're at the copier waiting to get it. So many print jobs are orphaned at machines. People print things and then never go and get them. So this cuts down on waste. So that's a good addition to our repertoire when it comes to printing. Our contractual services budget's always in motion, so I tend to go through this really quick. If you want to stop me, please do. So overall, increased by 19,000. So the decrease we talked about with splitting out the Google account costs saves 37,000. MIT share of that's 3,000. The new desktop and patch management software, as much as we like it a lot more than our old solution, it's way less expensive. So the licensing on that's going to be a net decrease of 15,000. Typical 3% and 5% increases. That's your the Granicus and the Tyler Technologies line item. That's a big number because part of our acquisition deal with Tyler Technologies for Energov is that our first 2 years of support were going to be at half price. Well, come the tail end of 23 is when year 3 is going to come due. And that's a much larger budgetary number. So that's where you see a large increase in that line item. That is the 1, 2, 3, 4, 5th bullet there, 86,250. $3,500 for a new version of our GIS software. This is the first increase in that line item for quite some time, but the new version also comes with increased maintenance and support costs, so that's that $3,500. The virtual desktops that were implemented by need during the beginning of the pandemic almost immediately. We stood those up in March of 2020. We had been using CARES Act funding to pay for those. Obviously, that funding is no longer available, and those virtual workspaces are still being used. So that's a new line item to pay for those. Post-warranty support for servers, that contract that company got acquired and the rates are going up. But we do really like the service we provide, so that's a slight increase. Slight increase to our firewall software subscription because we also replaced it, and the support for the newer models a little more. Backup appliance maintenance and support increasing by a little more than 1,000. Again, as I said earlier, it's licensed by how much we're backing up, and that grows and grows and grows over time. So that's $1,000 increase there. With Energov coming online and some new Munis and timekeeping things coming online, we wanted to increase the PACE 15 package, put some extra hours in there. This is actual like personalized additional training, not even necessarily for like your end users, but like for finance employees doing specific tasks. You'll get a one-on-one support, additional developmental help, things like that. And this is an ongoing item, but we just put a little extra in there because we knew with Energov coming online that there would probably be a need there. The GeoCortex software, the version we've been using is quote unquote ancient from Sean. This is going to license us for the new version moving forward, which of course, instead of being a persistent license, is now software as a service, which is the way everybody's going. So you can't just buy it once. You get to buy it every year forever. Aerial photography upgrade from 6-inch to 3-inch. So for years now, we've been having this aerial photography shot at what's called 6-inch resolution. I'm not going to pretend to know exactly what that means. We would need Sean for that. But the way it was explained to me is like things like manhole covers. They were not clearly visible or measurable on the 6-inch resolution, but with the 3-inch resolution, you can actually see individual manhole covers and geolocate them on the aerials. So that's an increase of 11 grand. And then due to us continually working towards our virtualization, we went ahead and put an extra 1,000 in the VMware support maintenance, because as we grow, the support costs will grow. So if we get to that goal of 8 for next year, the support costs will actually go up on that. No changes to dues and memberships. No changes to training and education. Our enhancement requests. So as part of the ADA compliance push, while we're doing an amazing job of the actual web pages and remediating that and making that content compliant, the PDFs are an entirely different story. A lot of times they are scanned pieces of paper, sometimes even handwritten pieces of paper that cannot be made compliant, which this bucket of money, what it would allow us to do is, so all these PDFs that are hosted on our website, there's a disclaimer that basically says if you require an ADA compliant version of this document, to reach out and one will be provided to you. Something like the budget book from 1993 is not something that we can do in-house, but we're obligated to provide that. So this would be almost like an emergency remediation for a specific document. It would be a bucket of money that would be available for us to pay, because these remediation costs for PDFs can run $25, $30 a page. So,
Brian, just point of clarification,
Yes,
are
ma'am.
these in the budget presently, or are these above and beyond what we see in the budget?
So
book?
the first two are,
Okay,
in the budget.
that's just good to know as you go along.
Yeah, the second two are not. So, but I wanted to, I just wanted to include everything that we actually submitted requests for. I hope that was appropriate. So anyway, the ADA compliance, bucket of money to fix things when people ask. Overtime budget for our staff. So we have 4 non-exempt members of our staff, which are basically hourly. And they very often will respond on nights and weekends. Our GIS staff often is asked to staff the emergency operations center during snowstorms, hurricanes, things of that nature. And for many, many, many years, the only way to compensate them was with comp time. And Sheila probably remembers my rant on comp time from last year, which is the problem with comp time. And if somebody accumulates a lot of comp time, the problem is that at some point they have to take it, which means you're without that person. So I find it better to just go ahead and compensate them monetarily for the time that they're putting in, get it out of the way, and move on. So that has been added to the budget. We're very happy about that. And then the additional analyst position was requested. That number that you see there is the all-in benefits included costs. And then the strategic plan, at some point or another, we really should have a new IT strategic plan done. That guides us as far as prioritizing projects and how to spend our money. The last one was done under Paul Thorne in 2010, so it's a little old. But we also understand we can't get everything we ask for every year. So, yeah. And that's about all I've got. And I'm happy to answer any questions. Do you want to get to Mr. Savage's questions first? And just knock those out. I have really quick, ready answers for those. If you want, I went ahead and reviewed those ahead of time.
Hello, Mike. Yeah, Alderman Savage had 7 questions, so we can go through those quickly. Yeah. First one is, do you currently have enough funds for the planned PC replacement frequency? I guess that's a yes, no.
Yep.
Okay. Included in the budget. Okay.
Yeah, the way we're structuring that, if we stick at our historical, well, not even historical, last couple of years since I've been here, if we stick to that $60,000, $70,000, $80,000 range annually, that allows us to cycle them through, and there wouldn't be any additional capital required to keep on top of that.
Okay. And partnering with the county on geocortex capabilities, he's assuming there might be some cost savings there, or at least some overlap.
So I posed this to Sean. So we attempted to do this with ArcGIS, which is an extremely expensive piece of software. ArcGIS did not like that. Esri did not like us trying to do that. They said, you're a separate agency, right? And we were like, yeah. And they're like, no, you need your own license. Now, regarding geocortex, she frankly didn't know the answer. So we're reaching out to our partners at the county and with the vendor to see, because I think it is an excellent question and one that I don't know that has been explored recently. So we will get to the bottom of that. And we'll let Mr. Savage know.
Great. And that explains the GIS kind of firewall that you get when you start mapping county. And so now I understand that. It isn't, they don't.
Yeah, one of our long-term goals is to bring all this information together in one place, but it still has to be separate. You know, some people, I don't need to tell you guys, there's plenty of folks that don't know whether they live in the city or the county.
I know even doing parks was crazy. Strategic plan. I guess this is a question for City Manager Jarrell from a management level. This has come up in the audit committee where we need a strategic plan. Is that what you're talking about? A city strategic plan?
This would be an IT strategic plan.
Oh, wow. It's that much for just IT.
The one that Paul did 12 years ago, it ran 40,000. So you figure 10, 12 years worth of inflation.
So City Manager Darrell, is this something that ties into a city sort of a left-hand, right-hand kind of thing here. How many strategic plans? How does that-
Not, I mean, sort of, but not really,
Yeah.
because what we were talking about for the city strategic plan is a much
Broader.
broader and
Yeah.
10,000 foot for
Yeah.
all of the departments, goal for all the departments. And we certainly considered the request from MIT, but number one, they're really busy right now with the implementation that they're undergoing. There was some thought that that would be done in-house, I think, and I just don't see the bandwidth. So we postponed that at least a year, that strategic plan, so it wasn't approved.
Okay. That's good to know. And what is page 16 of the budget book, which,
He's referencing the $100,000 line item in the capital outlay
Okay.
request
okay,
for the switch in the voice gateway replacement. That's a higher number than in years past because there are 4 of those voice gateways. They're extremely expensive. That is in addition to continuing to swap out older equipment at our remote sites. So City Hall, APD, EOC, Gorman have all been funded and taken care of. We're out moving through other remote sites now, replacing switches, bringing more modern gear in. But the reason that number hit 6 figures and kind of sticks out like a sore thumb is the voice gateway router addition to that number. And of course, there's implementation costs. We pay a consultant to configure, install this equipment. So that's not strictly a hardware number. It's hardware and configuration and installation.
okay. And a one-time cost, okay. What is proving to be a barrier challenge to MIT meeting your target goal to increase the number of PCs and servers joined to the domain? Said that was a struggle.
Yeah, it was just a reprioritization of getting the desktop management software implemented before we did the domain join. Again, we'll probably either very nearly get to or exceed our goal of 350 PCs and a dozen servers joined to the domain before June 30th, but we weren't there yet, and that's the reason why. We reprioritized to the desktop and patch management software, onboarding that, which will allow the deployment of the migration of the PCs to the domain to be easier afterwards.
And you may have answered this in your presentation, but what performance measure does that hurt, or does that hurt any of?
That was the goal number 5, I want to say, but I also would like to be sure. And now I'm editing my slideshow. Yeah, it's number 5.
Okay. That's so cool that you are doing just like the fire department did, is tying them into your performance and your efficiency. It's what performance measures are all about. That's great. Anyways, so what, you already answered this. What enhancements are included in the budget? I believe it was the first 2, and the last 2, the added position and the strategic plan are not right now, or not. And the last one, again, I think you addressed this in your presentation, did you not? Provide.
Yeah, and the version of the presentation that Mr. Savage probably read on Friday night or Saturday was not all the way complete.
Okay.
So yeah, there was additional information added. And I'm happy to answer any more of his questions. But yeah, the actual metrics, the performance measures were on those slides, but the objectives and the measurables weren't on there. So,
So yeah, just for those tuning in, what was presented today is different than what was attached to Legistar. So that's fine. It's more detailed and it answers his question. So I just wanted to.
Yeah, I apologize
No,
for that.
no
I
need
didn't
to
realize it was being
apologize.
posted ahead of time.
No, that's probably why you saw me kind of trying to download PowerPoint and looking a little bit preoccupied. I didn't mean to look preoccupied. Any questions from my colleagues on the committee? Alderman Finlayson.
Thank you. Mr. Packman, just a few questions. EnerGov transitioning from Trackit.
Yes, ma'am.
So how user-friendly for the community? The community uses Trackit quite significantly.
Yes. Significantly more so. One of the big goals of the EnerGov project is to allow not only for online permit applications, but also for online plan submittal. It's a workflow-based process where as it reaches milestones throughout the process, both the internal team and the approval process inside and the applicant are notified as it meets these milestones and moves forward. It's also one of the end goals is to keep people from having to come into the permit counter. So much of this will be able to be handled online. And to further answer your question, there's a marketing campaign that is being worked on with the PIO, an informative campaign to let people know how this is all going to work. So no, it is our belief that the end user experience will be much, much better.
So will the old system transition the resident who's using it? Will they have to do anything different, or is it all
If
generated
they're
by the
used to sitting
computer?
down at their computer and typing etrackit.annapolis.gov,
No different.
they'll wake up one morning and it's going to eTrackit will point to EnerGov.
Okay, so that was,
And so, yeah, I mean, new users, the links on the website will go to a different address, but eTrackit will redirect to EnerGov when the
okay,
time
so
comes.
we wouldn't notice anything different by using it? Or just the...
No, you'll definitely notice a difference, but yeah. Same website will point to the new place. Absolutely.
Okay, great. Ransomware. We hear about other municipalities being ransomed, and people and cities are paying it. I mean, millions of dollars. So how, I guess this is an obvious question, how are we protected?
It has been my policy to not discuss any specifics in public regarding that sort of stuff. I'm happy to answer any questions regarding network security.
I don't want you to
offline.
reveal anything. I just want you to tell us that you are on it and that we are protected and,
As I mentioned earlier, it's best to be humble going into these sorts of things. I think I mentioned either a year or two ago that if somebody wants to injure you in the world of cyber badly enough and is willing to devote the amount of resources to doing so, they are going to do it. Our strategy is to adhere to best practices as put out there by several national cybersecurity organizations, including the FBI and NIST. But yeah, adhering to the standards and doing the things that we're supposed to be doing is the best I can tell you without boasting or getting into technical specifics.
I'm good. I just want the community who may be listening to hear you say that we're on it. That's it. So thank you.
We have a very dedicated staff.
Munis. I think it's from Munis. I've been getting an email a couple times a week, I guess, that says, I need to update my account. You haven't done it since May 22nd, 2021. And I'm not questioning it because I probably haven't done it. is that going out? I thought we were leaving Munis and going to something else.
No,
We're
Munis
not.
is staying.
So I still have to go in and do whatever registration I have to do.
We would certainly appreciate it.
Does that include the workshops that I'm supposed to take?
We would certainly appreciate you doing those as well.
Okay, I did take one. Do we use the cloud, and to what extent?
Okay, the cloud is just somebody else's computer when you look at it that way. So anything that's hosted, as they say. So our website doesn't live on our computers, it lives on somebody else's computer. Your Gmail account doesn't live in a server here. It's on somebody else's computer. These Amazon workspaces are another really good example of cloud architecture. It is a Windows 10 desktop running virtually on a server in Reston, Virginia. So when you hear about the cloud, those are the sorts of resources that we use that are cloud-based. And more and more and more. Without being too long-winded, at the advent of the cloud, a lot of times cloud services didn't scale down to organizations of our size very well, which means they didn't make a lot of sense financially. But what's happening is, as time marches on, those gaps are being filled by other companies that would be more than happy to, scale down and make that affordable to you. And, of course, computing architecture marches on and things get more affordable. So you will see as time moves on that we will have a stronger presence in the cloud, but you might not potentially realize it.
So messages that I may get that says we're at capacity doesn't mean anything for me.
It's tough to say. I would have to see it.
Okay, I'll share that with you.
Yes, ma'am.
And a note just to myself about your enhancements. You got the first two bullets are in the mayor's budget.
Yes.
3 and 4 are not.
That's correct.
Okay. All right. I think that answers my questions. Thank you.
Certainly.
And thank you for taking care of us.
Not a problem. We enjoy doing it.
Alderwoman O'Neill? Do you have any questions? Alderwoman O'Neill, do you have any questions?
No questions at this time. Thank you. But thanks for the presentation.
Yes, ma'am.
I have questions. I forgot that Alderman Savage's aren't my questions. I just want the public taxpayers to know that you have a remarkable number of deducts. No, but do you know what I mean? Like I'm trying to make mathematical sense to this. If you go to your slide 14, well, actually, it shows more in your capital outlay adds or inclusions, and then in your slide 16, your increases and decreases. So could you speak to that, how you approached your budget in trying to minimize an increase?
Yes, ma'am. So the capital outlay portion, if you go back even farther than this table goes back, to 18, 19, 20, 21, generally speaking, MIT's cap outlay budget generally hovers, give or take $10,000, around $250,000. Mm-hmm. It's been pretty consistent for a very, very long time, not just with my predecessor, but with her predecessor. It was pretty consistent there. So in 22, you can see it was down slightly in 21, and then in 22, we were specifically asked to, from a cap outlay side, kick a couple of cans down the road, if you would. We were trying to really, minimize what we needed for that year. So when you see a $31,000 increase from 22 to 23, that's really more just reestablishing where we have historically been. It was all,
Well,
There
my
really
point
wasn't much.
Well, you replaced for $100,000 your network switch and voice gateway router replacement. So you have the cost of these gross ads, but your net for capital outlay was only like $30,000. That's my point, is that you captured these costs. The way they're presented in slide 16 is the value that you included.
Now you'll see in years past, since I've been doing the budget, though that number for the Cisco stuff had been higher, especially in the previous 2 years, because we started with City Hall and then we went to 199 Taylor Avenue for switch replacement. Those are the two head ends of our network, which means the switches are huge and extraordinarily expensive. Then we did some smaller remote sites, and that was part of our cost saving strategy for last year, was to just say, we're going to pick off these smaller sites that maybe only have 1 or 2 network switches at them. And then coming back this year, that $100,000 ask, again, includes those voice gateways, which are tremendously expensive, with some other smaller sites. So, yeah, I hope that kind of answers your question.
Yeah, it does. And then this is for Director Dickinson, just to be clear, is the only recurring expense, is that a salary? It's in salaries and benefits. I just wasn't sure what, I assume I know what it is, but just.
So there's 2 items that are recurring additions. One would be the overtime that they've added to their budget, because they never had a budget line item for overtime.
Okay.
And then $6,000 for the new paper cut software. Is that a one-time? Some of it may be one time, but most of it. So we do it every year.
Wouldn't that be one time?
For the first, I mean, I think that it's at least once it's over.
Katie, is the software in recurring expenses or a one-time? I didn't see it in the one-time list.
Recurring.
Yeah, it's a recurring expense, a payment for
that's
the
my
software use every year.
Oh, okay.
That should not have been under cap outlay. I apologize. It should have been in contract
so that's
services.
the recurring is the overtime.
No, I'm just pointing out budget highlights. I don't know what line item it's in.
I had it on my cap outlay slide, so I apologize for that.
No problem. And lastly, you're pretty humble about not speaking of what you had to do for COVID and working at home and all of that setup. Was that more last fiscal year?
That was more the previous
before?
fiscal year. I mean,
Okay.
once we had the infrastructure in place, we had handed out a ton of equipment, helped people get used to what they were going through.
Yeah.
I mean, yeah, the challenges were still there for sure, but they paled in comparison to what we had stood up and collectively, all of us, not just IT, had gone through the previous year. So, yeah, it's just a quick blurb that we're continuing to support it. Laptops break and get dropped and coffee spilled on them and things like that. So we still, we replace hardware, provide additional hardware, printers and things like that and scanners for home, things of that nature.
Can I clarify?
Of course.
So the paper cut software is in a line item called software, which does roll up to cap outlay. So you're.
Oh, okay, great.
So it is capital outlay. Okay. Alrighty.
Madam Chair, I have another question.
Sure. I'm done. Yeah, go ahead, Alderwoman Finlayson.
Mr. Packman, I don't know whether you have access, or Katie, page 57. We were talking about at the top, it gives you the budget summary. And then there's a list of contract services, a breakdown. Are those things included in the budget?
I'm sorry, I don't have the budget book in front of me.
Contract, Ms. Connolly, page 57 in our books, or Ms. Dickinson, or.
So yes, that is your list of contract services. If you were to add up all of those numbers that you see, you would get the total that's in the line item called contract services. It may be a component
Yeah, it's not.
of the 557,100. If you go into the online budget book where you could interact, and you click on contractual services, one of the line items is contract services. It's the lion's share of that amount. And if you add up all of these components, you will get that total of the account called contract services.
Okay. I guess I was kind of reading this page, since there's a break in the line, and I can understand the two columns. It just suggested that one column was not included and the other was, but I'm sure.
Yeah, that's just a formatting thing. It's
okay.
the two, doing the two columns, we split the sentence up.
Yeah. Okay, I'm good. Thank you.
But on paper, those numbers, on page 57, they don't match up to, the list that Alderman Finlayson's referring to adds up to,
So that should be, if you go to the budget, the online interactive budget tool,
okay,
and you click on that contractual services total, that's 557,100, you will see that it's made up of several accounts.
yeah,
Within those several accounts, there's an account called contract services.
is that the difference?
And these line items will add up to the munis account called contract services.
Okay,
It is a component of the 557,
okay,
probably the lion's share of the 557.
that's fine. Yeah, no, that's fine. I was just being a nerd and red dotting page 57.
So the reason that we've added this into the budget book the last couple of years is because Alderman Arnett wanted to see the breakdown of contract services, and I think we are required to show these types of breakdowns of, you just can't have a big account called contract services.
Right.
These are the types of things that are in there, and we are presenting the detail for each department.
You know, I thought I was gonna enjoy OpenGov, and now I can't find the page that I'm looking for. You know what? We keep talking about paperless. You know, at one time we were trying to eliminate the use of all this paper, and we seem to be going backwards.
Yeah.
So just a general statement about how much paper we generate. You know, years ago, we were trying to save the trees and not print everything and to use our computers, and
We're still trying.
now we're going backwards in time, I feel like.
So, just in the budget process, you
No,
mean?
just
or-
in general, just in general.
I would say my department's using a lot less paper.
Are you?
We're doing a lot more online and using PDF documents. I mean, there's some people that print as much as they used to, but there's others that are using a lot of the virtual tools that we have and the online tools where we can see PDFs. So I would say my department definitely has cut back on paper use.
Okay.
Yeah. Kicking and screaming, some people will be dragged into
Yeah,
the digital age,
yeah.
but on the whole, our staff at MIT has done an amazing job of turning what used to be paper processes into fillable PDFs. One of our accomplishments in the presentation was Ina and Joe have created these adaptive online forms. We're up to almost 60 of those now, all of which prevent someone from having to print, fill out, sign. I always find it to be the height of absurdity when somebody sends you something in an electronic format and you can do everything but sign it. So then you have to print it so that you can sign it, so that you can scan it and send it back. So those are the sorts of things that we're trying to get away from.
Well, surely you can teach us how to sign something and put our signature in our computer so that we can use
Absolutely.
it when we need it.
Yes, ma'am.
Okay. That was just a general statement, though. It wasn't about anybody specific. It's just as a whole, you know, we're not saving trees anymore for the most part. I mean, you go to the supermarket and you buy 3 things and they give you this much paper receipt.
Oh, God, CVS.
You know, everybody does it. You know, no matter what you're buying, you got all this paper. I don't understand it, but okay.
Yeah.
Thank you
You're welcome.
again.
And I think we did just pass legislation, if I'm not mistaken, on signing or something. Director, City Manager Carroll might know that. Didn't we just pass?
Yes, we had some legislation that's authorizing the city to move forward with a paperless signing tool so that we're not required to physically sign paper.
Yeah.
And I think that was initiated by the Office of Law.
Yeah.
And hopefully we'll be implementing something to circulate our agreements that way as well.
Yeah, I mean, if you settle on a house now, it's all electronic. Anyways,
As it should be.
yeah.
We don't circulate anything in Word because that can be edited. So, but yeah, no, with the passage of that legislation, it has made it much easier for us because by code, it was ink and paper. So passing that last year has made it easier for us moving forward.
My colleagues on the council, do you have any questions? Alderwoman
Alderman Gay, age before beauty.
Age before beauty.
What are you trying to say now, Alderwoman? I just have a couple of quick questions, but first I want to go back to this point because maybe I'm doing something wrong. Whenever I have to sign a document or somebody asks me to send something, I type it up in Word document, sign it, and then save it as a PDF. Am I doing something wrong?
No, sounds right to me.
Oh, okay.
Yeah.
I just wanted to make sure. I thought there was some software or something.
Sounds good to me.
I'm always shocked with the MIT budget because I feel like it should be higher as we move into this. We move. I think it's one of the departments that we should be like, all right, because of some of the things they've noted here today, cybersecurity issues, and then obviously we're moving into the 22nd century. Everything is going to be electronic or have some some IT component to it. And so I'm always shocked. But I think you all do a great job. Sean has been a great resource. She's helped me on a number of projects, actually. And so thankful for what she's done there. I've also have been one of the people who had a cracked iPad. So I'm thankful for the help there. I did have a question about the extra laptops and iPads and resources. Because one of my amendments this year was, and I've talked to the city manager about this, was to buy additional technology to have in our resource centers in both Eastport Terrace and Harbor House as it relates for applications or whatever people may need technology for nowadays. Like 1 in 4 families in public housing, and you can check this out for the Poverty Amongst Plenty study as well, have access to technology. Sure. With our leftovers or the older technology, is that something where we can maybe get like a laptop cart or an iPad cart and place those in the resource centers?
Actually, it does not need to be secondhand. We have provided computers and hardware for public use at both resource centers. If additional hardware is needed, my biggest thing with those sorts of things is that it not leave the center and that its use is supervised, so we can ensure that city equipment is being used in a legal and appropriate manner. Mm-hmm. But no, if there's at those resource centers, if there's additional hardware needed, Aaron or yourself, whomever, can reach out to me and we can take care of that. That does not need to be secondhand equipment.
Okay, and so no. Maybe a need to add it, maybe an amendment for the actual, maybe to buy it, or no?
We're talking about tablets, laptops, computers. Mm-hmm. No, that's something that we'll just handle.
Awesome, I appreciate that.
Certainly.
And then I had a question as it related to the ADA. I just put ADA further explanation. I seen that you were mentioning sometimes it's coming in a PDF form and it could be $25, or I think it said on the slide $15 to $20 a page.
It can be. If it's handwritten, it could be $40. 50.
And so this is just if citizens write in and request, you mentioned the budget from like 1978 or whatever. You have to go find that, print it out, and get it to the city.
Well, yeah. I mean, if it was from, like pre-internet age, the process would probably even be more expensive than what I'm throwing out there. But if it were, something, say, within the last 15 years, it would need to be remediated, and there would be a significant cost associated with that, and we are legally required to provide it. So that's just kind of a CYA fund there.
And there was something else. It's not here. I don't know why I just wrote down 48. I must have seen something.
Oh, those are the 48 was the increase in online adaptive fillable forms that the web team has come up with.
Oh, yes. Yeah, 48. Yeah. I just wanted to really credit the team. I know Ina works on that as well. I think one of those was the Office of Community Services web, which is made work easier for myself and for the Office of Community Services staff, because at first we were sending emails back and forth with constituents, and now they could just fill out that link.
Yep, and that is really the direct. I'm sorry to interrupt.
No, go ahead.
That is really the direction that we're looking to go. Is from a usability perspective. Not only are they more usable, they're ADA compliant. They're tagged properly. A screen reader goes through that and can read that off to a visually impaired person. Much easier than a PDF. PDFs are just a nightmare for compliance.
And last question, because I thought that was really great. The subscription cost for some of these are annual. You mentioned, for example, I think there was an update to the GIS. It may have been from the 6 to the 3 or 3 to the 6. I forget how it was mentioned. It was $7,300 a year.
Oh yeah, that's cheap in the world of software.
Oh, okay.
There's some. What I was referring to during that slide also, in that is the world of software as a service. It seems that the software makers are not happy only getting paid once for a product. Because people will buy a product and they will use it for 10 years, even though they come out with a new version every year. So we're seeing more and more Office 365, Adobe Creative Cloud, things of that nature, where you're renting the software. You no longer, most of the stuff in the Adobe Creative Suite can't even be bought on a persistent license anymore. It's all software as a service. So I just kind of threw that out there as a cautionary tale that you'll see as the years march on in our contractual services budget, you will see more and more of that, because it's going to be harder and harder to obtain a forever license of software.
That's interesting. And I guess that's something that we should look out for too.
As a consumer, for sure.
Absolutely.
Yeah, absolutely.
Awesome. Okay. I appreciate it, and I appreciate all that you all do, really.
Yes, sir. Thank you.
All right.
Yes, I have a question.
Oh, yes, Alderwoman Pendle Charles.
Thank you, Madam Chair. I too am concerned about security, as everyone is. And you indicated your training budget is not being increased. I would assume, but I guess I can't assume, that there would be more training when it comes to security for your staff, or not?
The increase really came as we headed into last year. There was I think we tripled it as we headed into last year, from 21 to 22. Our current funding level for training is okay, but yeah, it raised a couple of eyebrows a year or so ago when we tripled the training and education budget, and it was again wanting, and it's not. Dues and memberships and training and education not only are hours of classes that people take, it's also folks like Ina, our webmaster, going to the American Webmasters Association conference, being around her peers, hearing about the things that her her colleagues in her field are going through. Same with our GIS folks. Same with our analysts going to Tyler Connect. We are a big consumer of Tyler Technologies products. They throw this annual huge conference, multi-day conference. It's important for folks to get involved in things like that with their colleagues. So to answer your question, ma'am, the big increase was, I believe, 22. And that we considered that, I asked around to see what else they wanted to do. And it seems like what we've got them involved with is keeping them plenty busy for now.
Okay, great. You all are probably the premier folks that deal with every department. And so we really, 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 really thank you for everything you do.
Certainly. We really do enjoy it. So thank you.
That's obvious.
Yeah, you can tell that you do. That's really great. Wait a minute, we have a little consultation. Hold on. We come bearing gifts. We know this is hard for you, but a disclaimer with our gift that it doesn't mean total acceptance of your budget. That's all pending council review. But in the meantime, enjoy our gift. You have to catch it.
That's bouncier than I thought it was. Thank you guys very much.
Thank you. Thank you. It matters if you catch it or not. We do have legislation, and I know we're going over, but it wasn't a hard stop today, so oh, you're staying for this, aren't you, Brian? This is.
Yeah, I'm gonna hang just to make sure you guys don't have any questions about that other one.
Okay, colleagues, we'll move on to legislation, which is 014-22, which is debit card and credit card payments, convenience fees for the purpose of modifying the procedure for assessing convenience fees for payment of city services by debit or credit card and generally relating to processing those convenience fees. We did get a public comment for the record, which is not for the legislation. I think it might need some explanation to this particular resident because he interprets it as an additional fee. Yeah, his argument is that the city plans to bill us for city services as it should and then charge us to pay for these services. So I'm hopeful after we have a presentation on this ordinance that can be clarified. Who would like to speak to this legislation? It's sponsored by, was introduced by the mayor's office. So, Director Dickinson.
I will give you some background, and I'm glad that Brian is still here because part of this came up because of the EnerGov implementation. The way the code reads now, we can add a convenience fee for certain items. What our objective is to recoup the processing fees that we're paying for credit card transactions. If you were to total them across all budgets, tens of thousands, maybe hundreds of thousands of dollars across all departments with rec and parks, the utility billing process. So our goal is to try to recoup those fees. And what happens is some of the products we use to process payments will allow us to just choose an option that when somebody is using their card, the fee goes to the person using their card to pay. But not all of them can do that. So we also want the option to be able to assess a convenience fee ourselves for those products that we're using that won't do that. So we try to write this in a way that's more general than flexible to allow us to apply either we're assessing the fee back to the user or the software that's processing the payment is charging them directly. So this is what we came up with for that. When we're implementing some of the EnerGov has one way that they'll process certain payments, and then the utility payments have to be processed a different way. So it gets kind of complicated. So we're going to have to devise a system, once EnerGov is up and running, that we can try to assess for each fee based on what each payment processor can provide.
So it's not a blanket fee across the board, it's evaluated for each service.
Yes, and how we can do it, apply the fee. And then again, the objective is to charge the person that's using the card for the processing fee, because they can be quite significant.
Is this standard, for lack of a better word, is it standard practice with other municipalities?
I know the county uses it for some things. I don't know if they've applied it to all of their services. When I came to the city, I was surprised to see that the city's picking up every single credit card fee that's being assessed.
Right.
And like I said, it is sizable if you add it together.
Yeah, there wasn't a fiscal report attached.
Not yet, no. We haven't done that. We've been busy with it.
I figured it was hard to calculate.
Yeah, and I don't know that we will in the fiscal note, we will summarize what we're paying in credit card fees, how we roll it out, and how quickly we can get each component implemented. That may vary, so I can't tell you this is how much we're going to save next year.
Correct.
But the objective is to recoup the fees we're paying.
Yes, Alderwoman O'Neill.
Thank you very much. A quick question about that. I know as I was working with a constituent who is routinely come in to pay their utility bill, but circumstances changed where they no longer could actually walk in the door. Will we have pretty clear definitions? And I think maybe that's what Mr. Doyle's probably question is if I'm going in to pay a utility bill, will it say to me there will be a 3% processing fee added to your
I
payment?
believe all that has to be specified on the payment site when you're making the payment, that there's going to be a fee assessed.
Okay. Thank you very much.
Thank you so much. I actually had a constituent who was very passionate about this for a while, so I'm thankful that you're making it accessible. And I'm adding just support. It's just like you go to any store, or you try to swipe your card and they're like, oh, we have to charge you X amount because there's a processing fee. So this is totally normal. Yeah.
Right, yeah. Long overdue. Well, do we have any more discussion?
If I could add one
Oh,
other thing.
of course.
Because of the way we're handling cashiering moving forward with Energov, I just kind of wanted to chime in that we need this to go live with Energov. So I just wanted to throw that out there.
Thank you.
Yeah, in order to move and go live, we needed to tell Tyler that we are choosing this option or that option for the credit card processing. So we needed to specify, and we needed to get the permission, the authority, and the code to do it either way.
Wow. There's reason right there. Because we use Tyler for a lot of stuff, it seems. Yeah.
Tyler's the company that provides Munis and Energov and Tyler Cashiering and
That's why we see their
And the
name a
CAD and
lot.
RMS for
Yeah.
the police department.
Yeah, a lot of our products.
Yeah, we talked about this a little bit at budget time last year. A big part of our decision-making process with staying with that Tyler family of products is a unified workflow, a unified kind of dashboard for our end users, where they're going to be involved in multiple projects or multiple products, I should say. And just from a practical perspective, getting workflow notifications in this app, and this app, and this app, and a unified workflow just makes a lot of sense and was a big selling point for us.
Absolutely, I can understand that. Well, at this point, I'll entertain a motion for a favorable recommendation for 014-22, debit cards and credit card payments.
So moved.
Second?
All in favor signify by saying aye.
Aye.
Okay, colleagues, we have on the agenda 015-22. I'll take the three together. The annual budget, and we have the two resolutions for the fees and the fines. I would entertain a motion that we are not taking action on this until, we go through this week of review process. So I guess the motion I'd entertain is what is standard practice to keep it when it stays on the agenda for
Madam Chair, I
Couple
move
of
we
weeks.
postpone action on
just
this.
keep postponing action. Yeah. That makes sense to me.
Yeah, I think we are going to have a discussion in a work session, are we not, about the tax levy, or are we not having that discussion?
I'm sorry, what are you talking about? Are you still talking about the credit card one, or?
No, the ordinances and the resolutions for the budget
The fees and the fines.
Yeah, we're going to postpone action until
Until the public hearing, yes. I think the public hearing on, I don't know when that resolution public hearing is, if it's at the same time as the budget ordinance or not. It is.
Oh, okay, so,
So I'm not clear then. There's a public hearing on the budget after we finish with the budget, correct?
Is that true?
So is that what you're talking?
I'm
you're
looking at
referring to?
Takia.
I'm sorry.
The public hearing follows the Finance Committee report?
No, they're going for public hearing on next city council meeting.
On the budget? Oh, for some reason, I thought that came after.
It's possible it stays open and doesn't,
Yeah.
well, wouldn't,
Okay.
But no, for the budget, we always place it on before the public hearing.
oh, okay. 'Cause- So doesn't presentation of our Finance Committee budget report on May 9th to the city council, isn't that our action on this? Or, yeah, I would think that would be our action on this.
Yeah, I think at some point you'll have to, I think, formally make a motion that it be forwarded on to
Yeah,
the full council with your approval.
right.
But the report does that as well.
Yeah, just before the 9th, we'll take action and then report forthcoming or something like that. So I guess we have to entertain a motion to postpone action on this until that time.
Did I make a motion? Oh,
You did.
I already made a motion
Oh, you did?
But
What was it?
that we postpone action on 015 as well as
R23 and
R23 and R24.
I'll second.
Sounds good to me. All in favor signify by saying aye.
Aye.
Aye. All right, I think we did well for a big department. Thank you for keeping us on task here. So with that, I will entertain, unless there's any, yes, Alderman Gay,
I do. I have one quick question.
of course.
I've been thinking about it the whole meeting. You mentioned earlier that as chair, you would be looking at this budget through an equity lens, and I just want to know how you plan to do that.
I don't know. Ask good questions.
Yeah, she mentioned that in the beginning.
Yeah,
That
I mean, as it applies to each department, how they're servicing our disadvantaged communities. And that was a difficult question to ask, like the fire department, because they can't really, a little piece of that was Alderwoman Finlayson's question about the diverse makeup of their department, those kinds of questions. I think it's important. And you can help with that. You
I
can help
agree
with the right
wholeheartedly.
questions.
Yeah, that's great.
Thought you would. Thanks. All right.
Maybe we could also ask them to give us a breakdown of their department, the diversity, how their departments look. So, because we did pose the question
Yeah.
to the fire chief.
We did ask that for fire, specifically when it's such a high percentage.
But just so
of
the rest of them will know that question is coming.
Yeah. Thank you. And I don't see that, Director Dickinson, do you have anything to say other than, let me get back to work? It's not on the agenda, I just wanted to give you an opportunity to say anything.
no, but I will say that we do have some supplementals coming to you, hopefully this week sometime. I think Katie's trying to get caught up with everything. Several requests for supplemental appropriations, and maybe, I don't know if there's any fund transfer that is large enough that has to come to you, but we'll be bringing those within the next couple of days, and so there may be some other things added to your agenda that you'll need to consider.
Try to avoid.
From a timing perspective.
Yeah, just try to avoid the big department meeting ones, maybe. No, that's fine. And then for next week, City Manager Jarrow, could you just ensure that they're current with their presentations, and it is, the updated presentation is what's before us on Granicus instead of it's just confusing, even though it's extra, they've done extra work, but it gets confusing for my colleagues who are watching, et cetera. So.
And please don't use the format that was used today, because we can't download that. So
Right.
You can.
Yeah.
You have to have PowerPoint. You
just have to add PowerPoint, which yeah.
Is that why you couldn't get it?
Yeah.
You don't have PowerPoint?
I add PowerPoint, that's why.
Okay.
Yeah, that's cool. No.
Ms. Dickinson, I still am going to sponsor that amendment to the code about your authority. Yes. So don't think I've forgotten. I have not.
I've had a couple more inquiries lately. Could I waive a fee? Can I waive a fee? And so, yes, I'm waiting for that to come down.
Just for your notification, the finance director cannot waive any fees for any reason.
Unless it's something that we did wrong, unless we can find that we made a mistake somewhere. We do not have the authority to waive a late fee for the billing process.
Okay.
So
And
I will share that once it's written with you, with hopes that you'll sponsor giving her some flexibility.
Those kind of fees, but not like special event fees. You don't
No,
want,
no, no,
you
no,
don't want that. You
No,
don't want-
like, I had a resident who called about her water bill that was it the water bill? I guess it was the water.
yes, most often it's the utility bills, and the complaint is usually, and I agree, I've always paid on time. This one time the US mail has been spotty for the last couple of years, and people aren't getting things consistently. So we have delayed placing the penalties on the accounts by a week, but we can't do it forever because it's not allowed, really. We're authorized, we are directed to charge the penalties if it's late. So I know the county has authority that allows waiver of late fees once every so often for an account. Like the person on the account can ask for a waiver once every year or once every 2 years or something, and the finance staff can grant that. But as of right now, I don't have the authority to do it.
Is that easy to track?
Yeah, we have note fields in the utility billing system that would allow you to say this person received a waiver on this date.
And this allows her to also look at the history, which she just mentioned. So if the person has paid their bill every month and this is one time, then she could waive that. So that's forthcoming.
I'll sponsor that. Co-sponsor.
Great.
Yeah,
thank
me
you.
too. Yeah, me too.
It would be, I don't know what is in here, but stuff is falling out from under this desk.
Oh, my God.
This is somebody's lavalier.
So tomorrow we have OEM and transportation. So that's a big one. They're both big, Okay. So do I,
right.
can I have a motion to adjourn?
Move to adjourn.
Second.
All in favor signify by saying aye.
Aye.
Aye, thank you so much.
All right. Good first day.
Good job.
Yeah.